السلام عليكم.
وعليكم السلام ورحمة الله.
How are you guys?
Thank you. We are okay. I hope you are okay.
Okay, today inshallah we will continue for communication skills. As usual, the most important in any station, you will focus on what? How you get the high mark in this station. It depends on the pie chart and also which area you will mention in details, which area you will mention by concise way, which area you will skip. Okay. As I said before, for example, you have in resuscitation station, all resuscitation stations, you will start the same approach. A, B, C, D, E for all stations. But not all stations you will focus on A, airway. Not all stations you will focus on B. Okay. If the patient has tension pneumothorax, he's talking, you will not take time in airway. Like 2 seconds in airway. Is the airway patent? Yeah. So you will go directly to breathing. If the breathing is okay, no need to waste the time in breathing, and so on. Same as in any other station. Same as in any other station. You will focus on what? Okay. These are the communication skills. They are not testing your knowledge. If they will test your knowledge, they will give you written exam. Okay. They want to test your skills, how you will deal here and here and here. So as usual, the most important thing, how to get 10 out of 10, avoid jargon. Always, if you feel you are talking too long, stop. Even you are explaining management plan, you feel you are talking too much, stop. Ask the patient, is that clear? Did you understand? And continue, and so on, okay? In all stations, whatever history, whatever psychiatry, whatever examination or resuscitation, you will find what, guys?
Communication.
Communication. Excellent. So communication skills doesn't mean communication station. Some people, they think if they find in the pie chart the communication skills, yeah, this is communication station. No. You will find the communication skills in all pie charts in the exam. In history, because you are communicating with the patient. In psychiatry, you are communicating with the patient. In examination, you are communicating with the patient. Also in communication skills, because it's a communication station, okay? You will communicate with the patient also. And in resuscitation, you will communicate with the patient and the team. They are testing your communication skills. So if you find communication skills with high mark, focus on communication skills. It means sending, receiving, simple way, and check understanding, and that. Here regarding a station of communication skills, what is the most important in communication station, guys? History or communication or what? Which skills is important here today?
Communication.
Communication. So here they will test your skills in communication skills. For example, breaking bad news. So your communication with the patient, Are you sad? Like here? So sad here, empathy or sympathy?
Empathy.
Or sympathy?
No, empathy.
Or sympathy? Okay. So if you feel sorry to the patient, you are showing that you are sorry to the patient. It's sympathy. It's empathy. Okay. But if you feel you want to show the patient you are feeling her feelings, so it's a sympathy. Okay. So anyway, your tone, your speech tone should be slow. Your speech should be low pressure. Okay. Good eye contact. They will not test your information. They will not test your knowledge. They will test only the required information regarding this station. Okay. But the most important, the examiner will check your eyes with good eye contact or not, your attitude, body language. Okay. So communication skills, very, very, very important and very easy to get marks. Okay. So always read the introduction, please. Okay. In communication skills, we will discuss breaking bad news, child died, wife died, husband died. So fetus died. This one died or going to die, guys?
All died.
Died. Okay. So it will be clear in the notes. In all communication stations, don't go to the patient without checking the notes. So fix introduction in all communication stations. Greeting all. So I will knock the door. I will go inside. Okay. Good morning. No need to introduce yourself now. Good morning. I will turn off my bleep, my phone. We are in private room. One nurse with us. I will endorse my patients to my colleague. Okay. So, for example, you are the most senior doctor or you are the consultant. Okay. You will hand over your patient to another colleague because you will be free for discussion. Okay. You have to mention that. After that, I want to check the notes. They will mention in Breaking Bad News, you have 1 minute to read the notes inside the room. So you have 1 minute outside the room, and they will mention you have 1 minute to read the notes. Okay. So here the examiner will check you are reading the notes or not, but don't waste the time within 1 minute. Maximum 30 seconds. Don't waste the time more than 30 seconds because maybe you will waste the station. Okay. So once you go inside, after you read the notes, when you are reading the notes, check the notes by your eyes and by your finger from up to down and show the examiner that you are reading and show the examiner your expression. You are reading the 7 years old, his name is Tahir and he was in the river. After that, blah, 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 blah. Are you sad as a physician? You are reading these things, guys, you will be sad?
Yes.
So you have to show the examiner that you are sad, your expression. He's looking at you, but you don't know. So when you are reading, at least show expression like that, okay? So by your eyes, by your finger, and show expression, okay? After you finish, the most important for you, 3 points. This patient died or not, going to die or not, or serious diagnosis. So going to die, you will mention the patient is not survivor. For example, the patient has a stroke. How to know a stroke died or going to die or serious diagnosis? Died, he will mention in the notes, the patient died. Okay, but how to understand going to die or serious diagnosis? Anyone has idea? Patient has
Going
a
to
stroke.
die,
Low
going to
conscious
die
level, low GCS.
If the patient has low GCS and whatever deterioration, it doesn't mean he is going to die, right?
Yeah.
Maybe serious diagnosis. How to understand it's going to die or serious diagnosis? I want a clear idea.
patient will be in recess, like a post RTA. Maybe he's going to die if serious mechanism of injury, for example.
Massive hemorrhage, brain death.
Any patient whose resuscitation is going on in the emergency and you want to counsel their attenders about the thing.
Okay.
No intervention.
Okay. Going to die, they will mention, for example, the patient stroke, maybe hemorrhagic stroke, severe, they will mention like that. Massive bleeding and seen by neurosurgeon consultant, and he said it's not survivable, okay, not operable. This means he's going to die, okay? But if they said the patient, for example, he has a stroke, ischemic stroke, and he has weakness, paralysis, but they did not mention in the notes he is not survivable or not operable or, okay? So it's a serious diagnosis, okay? So the most important, check the notes, okay? If died, going to die, or serious diagnosis. And also in going to die, they will mention the consultant advice for to be comfortable. The patient should be made comfortable, okay? So diet like the cases coming in the exam in usual, drowning could be child, cerebral palsy, the patient already has cerebral palsy, and wife died RTA, meningococcal septicemia died. Okay. Here, husband, MI or pulmonary embolism, he came with severe chest pain after that infarction or pulmonary embolism and died. Fetus died, miscarriage. Miscarriage here, some people, they have confusion. Is it history taking or communication skills? How to differentiate between them guys from the pie chart?
The large the large mark will be in communication skill, not in the history taking.
So if you don't find the history in the pie chart, it will be history?
No.
No, it will be very clear. Why you are confusing yourself? If you don't find the history, it means it's a breaking bad news. But if you find the history, it means a history. If you find in the pie chart history, it means a history. No history in the pie chart, it's breaking bad news. Done. Okay? Husband is going to die, so massive intracranial bleeding or subarachnoid hemorrhage. And they will mention, as you said, not survivable or not operable. Hematemesis, comatose, alcoholic. Also abnormal chest mass cerebral edema. Mother is going to die. She has cardiac arrest 3 times, always coming like that. And ROSC, after ROSC, hypotension, GSS3, despite medicine, despite drops, despite everything. And they said, it's not DNA CPR. It's not DNA CPR, take care, okay? So they just mentioned the patient is going to die because not responding to medicines. Husband has serious diagnosis, C4 fracture. So the patient here, serious diagnosis or going to die?
Serious diagnosis.
Okay, serious diagnosis.
As
So
always.
yeah, you have to break the news to the wife. You have to discuss about ICE. ICE, it will be after the management or before the management?
Before
Before the management.
Before the management. So here in any serious diagnosis, it means like explain new diagnosis. Same. Serious diagnosis like explain new diagnosis. Okay? You will explain the disease. You will explain, also you will ask about ICE. You will explain the short-term management. You will explain the long-term management. But the difference here, you will break the news. You will give the introduction of breaking bad news. Okay, this one long-term life condition, guys.
Yes.
How you know? It's not long-term condition.
maybe
Okay, C4 fracture. It's not. It's not long-term condition. Maybe the patient will be okay after months, years. We don't know. Okay.
Yeah.
Okay. Cirrhosis,
Cirrhosis.
is it long-term condition?
Yes.
Most
Yes.
probably.
We don't know. Maybe he will do heart liver transplant, right?
Yeah.
Okay. So here you have to give the breaking bad news and discuss the possibilities, but check the concern first. So C4 fracture, you will talk with the patient or the relative. Cirrhosis, you will talk with the patient or the relative.
For cirrhosis, talk to the patient.
Cirrhosis may be the patient, may be the relative.
Yeah.
Cirrhosis may be the patient, may be the relative. But C4 fracture with who? With the patient? Of course not. The patient will be
Relative.
To the relatives.
the relative, okay? Because C4 fracture, maybe he's intubated, right?
Yes.
For sure intubated, okay? Because it will affect the breathing. Okay,
Yes.
so prepare yourself for that. If you find drowning, for sure die. If you find cerebral palsy, for sure die. RTA, until now, we don't know. Maybe died, maybe going to die. But usually coming as died. Meningococcal septicemia, for sure died. Okay. MIBE, for sure died. Miscarriage, the patient, the fetus died, for sure. Okay. And also check, maybe the fetus is still alive, but maybe it's a high risk to die. Okay, so anyway, depend on the notes. Don't invent or don't be scripted. Okay, and so on. Later, tomorrow, we will discuss difficult referral. So here you will use ICE-PAR. We will discuss in details. So it will be for DKA, VB shunt, chest pain, Smith fracture. Also, one station, it's not common. Elderly care and frailty. So the patient has maybe metastasis or spinal, end stage metastasis, and also referred from ANT to medical team, but through you. Okay, you will be the one talk with the medical team. So it's the same steps, inshallah. And here angry patient or relative. Okay, so here the patient is talking to you, or he talked with your colleague. After that, he came to you for second opinion.
Second opinion.
He came for you for second opinion. Okay. For example, the patient, the mother, talk with your colleague, and she requests antibiotic. Okay, your colleague, junior doctor, and she want antibiotic, and he's refusing. She asked him, "I want to talk with the most senior doctor." She came to you. You will convince her. So you have to discuss with her. I think you have concern. Is that right? Blah, blah, blah. Can you tell me more about that? Why you are requesting for antibiotic? So explore more. And after that, convince her. The opposite here, she is refusing treatment. Okay. And refusing discharge, vomiting the child. So I think you have concern to discuss with me today. Is that right? Yeah. She came to your colleague. He advised her to discharge, but she's refusing. She wants to talk with the most senior doctor, you. So you ask her, why you refuse discharge? Because I'm worried. Why you are worried? Maybe he has appendicitis. Why you think it's appendicitis? Can you tell me more? Because I have nephew, blah, 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 blah. And he has the same problem, vomiting, and they discharge him after 2 days. He has appendicitis. So let me ask you some questions to see if your son has appendicitis. Of course, you will check safety of the patient. How is your son now? He's playing. Okay, he's comfortable now. Yeah. So before you start, you have to check comfortability and pain of the patient. Okay. So anyway, we'll discuss that in details. Mother refused discharge and request X-ray. Same idea. Check why she has concern, what her concern, and why she is concerned about that. What is the reason behind that? And here, don't say, okay, let me examine your son. No. Is it logic, guys? Is it logic to examine the son?
He has been already examined.
No, it's not logic to examine the son or the patient. So your colleague take history from the patient and examine the patient. No need to say, okay, let me to examine your son and see if it's appendicitis or not. No. If they want to test your skills in examination, they will give you patient with appendicitis and they ask you to examine the patient, right? They are not testing your skills in examination here. So I want to ask you some questions to see if your son has appendicitis or not. So you will ask about questions of appendicitis. For example, where is the pain? Does he feel sick? Did he vomit? Also, did the pain migrate from center of his tummy to lower right side? And also for how long? Okay, and so on. Okay. So here, the patient has back pain. Back pain, she came to your colleague and he wanted to discharge her on ibuprofen, but she doesn't want to discharge. She came to you for a second opinion. You are the most senior colleague. You will examine her?
No.
No, don't offer examination. If you will offer examination, it's not logic, okay? So, may I know your concern? Yeah, your colleague, he want to give me painkiller and discharge home. He said it's just a muscle pain and. I'm sorry that you feel that way. Can you tell me why you don't want to be discharged? What is your concern? So ask about ICE first. Always in any conflict, ICE first. Okay. So she will say, I'm worried maybe this is cancer in my back, or maybe fracture, or. Why do you think it's mass, or why do you think it's malignancy? Why do you think it's a compression? Because I have one friend has some symptoms and diagnosed before with spinal metastasis, and I'm sorry. How about him now? It's okay. Okay, let me ask you some questions to see if you have serious problem in your back or not. Clear, guys? It will be history, but eyes first. Okay, so you will use the same approach of conflicts. It means you ask about the concern and you explore more about the concern. After that, ask about eyes. Okay, after that, explain and take data regarding the history to see if this back pain is serious or not. So you will ask about all questions regarding back pain. You will take brief history regarding back pain. Okay. After that, she will deny everything. For example, do you have a weakness or paralysis in your lower limbs? No. Any urine retention? No. Or you can say any urine problem like retention or incontinence? No. Do you have bowel problem like constipation or loose bowel motion or incontinence? No. Okay. Do you have problem if male? Do you have problem in sex drive? Do you have sexual dysfunction? No. Okay. Do you, where is the pain? Socrates from the start. Okay. So she will deny everything. According to your data, I have good news for you. You don't have any worrying symptoms indicating malignancy or fracture or. So I think you agree with me now. You can be discharged on the painkiller, and I will give you printed leaflets. You can go home and you can come back if you have any of the worrying symptoms I asked you. Okay, did I mention examination, guys?
No.
No. Okay, so convince here by history taking, by communication only. Don't touch the patient. Okay, they are testing your skills in communication, not in examination. Leg pain, it will be the same. You will take back pain and leg pain. Which approach?
Socrates.
Socrates. Okay. So you will start by Socrates. After that, the most relevant questions in associated symptoms, it will give you idea. And the brief history, for example, back pain or leg pain. Leg pain here, if you will go for past medical disease and also previous surgery, it will be helpful for DVT. So if you will go for general approach and the brief approach, it will help you to resolve the conflict. Okay. The next day, or maybe the same day, we will discuss a complaint. So maybe angry patient or relative. Okay. So the most common pneumothorax, they can give you pneumothorax here. It will be a small or large, primary or secondary spontaneous pneumothorax. Okay. Don't be defending. So this patient came to you or came to your colleague?
Same, he came to the colleague.
The patient already came to your colleague, and now he came to complain to you. You are the most senior, okay, or you are the consultant. If you If you are the most senior, you can address medical aspect first and the legal aspect second. What is the priority, medical aspect or legal aspect?
Medical.
Medical aspects. Okay, so how can I help you, or what is your concern? I'm sorry to feel that. And can we sit in private room? Would you like to give you anything to drink? And let me to think about your safety first. Medical treatment first. Okay. Are you comfortable? Do you have any pain? So pneumothorax here, what are the most important questions, guys? 3 questions.
Age, smoking, history of lung disease.
Excellent. So pneumothorax here, age, may I know your name and age? Done. This one done from the start. Number 2, do you have any lung disease before? Number 3, do you smoke? If yes, how many cigarettes per day? Because smoking, it's not enough. Smoking may be primary or secondary, but if you check the algorithm, significant smoking. Okay, so you have to ask about the pattern of smoking. Okay, so let me to check your safety, medical safety first. Are you comfortable now? Do you have any pain? Let me to move you to resuscitation room and check your vital signs. Do you have any pain? Do you have any shortness of breath at the moment? Yeah. Okay. So I check your X-ray and I found, yeah. If it's small, say it's small. If large, say it's large. Okay. But don't say it's easy to be missed. No. Don't defend your colleague. Okay. So if it's small, I'm sorry that my colleague, he missed this diagnosis. But I have good news for you. It's very small. This is how to talk about small or not, but not defending. Okay. So what we are gonna do now, I want to ask you 2 questions to check if it's a serious problem or not. Do you have lung disease? Past history of lung disease? No. Do you smoke? I don't care about illicit drugs. It's not in the algorithm. I don't care about other history. So not in the algorithm. So if yes, so how many cigarettes per day? After that, if you feel it's a primary, manage primary with whatever needle aspiration. If secondary, maybe needle aspiration or chest drain. Anyway, it depends on the station. Less frank fracture, so it will be the same idea. Medical aspect after that, legal aspect. So legal aspect here, I want to reassure you that we are taking these incidents seriously. We will inform the consultant. If you are not the consultant, if you are the consultant, you should say, I am the consultant here. I am the most senior here, and I am aware about this problem. I will take this incident seriously. Okay, so you have to discuss about this point first. We will discuss with the concerned colleague to search for the reason behind that. We will make departmental meeting. We are learning from these mistakes, okay, to not happen again. And you can escalate steps. We will discuss everything in details in this day. Morning after bell, so here you will discuss about Gillick and the Fraser, and you have to discuss about the indication why your colleague, he gives the patient morning after pill. So you should inform the mother or the father about the indication. DNA CPR, here the same station of breaking bad news, but don't break the news. The patient here, at any time she will arrest, and the consultant, whatever cardiologist or neurosurgeon or so he took a decision to not do DNA CPR. So you have to explain about CPR, you have to explain about DNA CPR, and you have to ask about the concern first. Any conflict or any complaint, ask about ICE first. Okay, what is your idea? What is your concern? What do you expect from us to do? What do you want? Okay, after that, you can explain in details. Counseling and advice, BIPS. So BIPS here, the same as history taking, but maybe she doesn't have symptoms. Okay, so whatever she has symptoms or not, you will follow sexual history, whatever male or female. Post-exposure prophylaxis after sexual intercourse. So it will be history taking. She came for counseling. I think you have something to discuss with me today. Yeah, can you tell me that? Blah, blah, blah. Ask about ICE first. Any counseling? Conflict, complain, counseling, ICE first. Okay. What else, guys, we discussed before ICE first?
Explaining new diagnosis.
Explain new diagnosis. Excellent. Okay. So here, BIP after needle stick injury, the nurse came to you. Okay. Always address the safety first. So the patient came to you with needle stick injury. So safety first, it means immediate dressing, immediate washing. Before, so private room, discuss, offer something to drink, and also you can ask here, what is your concern? I have blah, 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 blah. Yeah. Did you do dressing? Did you wash the wound? No. Can you wash the wound and encourage bleeding? And then we can chat again. Done. Don't waste the time, just verbalize and continue. I will discuss this in details. And you will take history. It will be brief history. History regarding the needle, history regarding the recipient, history regarding the donor. You have 3 points in the history. After that, brief history, past medical, past surgery, any family history, and so on. Blood splash, it will be the same, but you have to inform the patient about the risk of needle, about the risk of splash. Blood splash, it will be in the eyes, nose, or mouth. Pregnant mother with child with chickenpox, you will ask about eyes first. After that, you can answer any question she will tell you. It will be knowledge. This station, 100% knowledge. Miscellaneous here, consent from a source patient after needle stick injury. It means you will go to the patient in the his room and ward, and you can inform him you came for consent. And the consent here, it means indication, contraindication, complication, also risk and benefit, and ask the patient about his concern and about the consent. Clinical decision unit, you will hand over patient from a colleague. Difficult conversation with a colleague. Colleague here, maybe he is drinking alcohol. That's why you will, the nurse came to you. She said, I found one of the junior, you are the most senior or you are the consultant. One of the most senior, one of the junior, he smells alcohol and blah, blah, blah. So you will discuss with the colleague. And also maybe your colleague complained by the nurse, he is not washing his hands. Or maybe he's not wearing PPE. Or maybe he is shouting to patients. Or maybe he is treating patients inappropriately. not following the guidelines. So you have to discuss with the patient, and also you will inform the clinical supervisor or not. You will inform the medical director or not. You will inform GMC or not. Okay, we will discuss that. Certified nurse midwife relative to family of non-accidental injury. So try to converse here to talk with the pediatrician. So this patient is non-accidental injury, 2 years. And here the nurse, she is not in ER, the nurse midwife. She's not working in ER, but she knows the family and she is ashamed from the family. She wants you to just give treatment and they will go. Okay, so you have to ask about ICE first. What is your idea about that? What is your concern? What do you expect from us to do? Okay, and brief teaching about non-accidental injury. After that, explain to her our policy to raise our suspicion of non-accidental injury in such cases, blah, 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 blah. And you have to inform the pediatrician, you have to inform social services. And also, we are not accusing the family, maybe someone else. And we will discuss everything in detail. Major incident plan, trust you. We will discuss that also later. Okay, we will start in breaking bad news. We have Dr. Gul, Dr. Abdul Rab, Dr. Sameh, Dr. Ahmed Al Amin, Dr. Fayo, Dr. Omar, Dr. Ines, Dr. Raji, Dr. Tariq, Dr. Ikra, Dr. Militi, Dr. Okay. Okay. So we will start by Dr. Gul.
Yes, Dr. Hani.
Yeah, you have 30 seconds. After that, you can start. You can start.
Good evening. I will ensure that department is safe and control of department handed to senior. Will close my mobile in a private room and one nurse with me to support the family and fully aware about my patient condition. Good evening. My name is Dr. Gul, one of ED doctor.
Check the notes. Read the notes.
So we will not go like that with Dr. Hani.
They will give you the notes. You can wait for
We will work.
30 seconds to read the notes. Pretend that you are reading the notes.
Okay. So I will read the notes and I will fully aware that I know about my patient condition fully. So good evening. My name is Dr. Gul.
Wait, please, Dr. Gul. Wait, please. I want you. We will start again, please, because this is very important.
Yeah. Okay.
I will do for you, and you will repeat again. Okay. We will start the 60 minutes again after I finish.
Okay.
Good morning. I'm not talking to the patient now. I'm just greeting all. Okay.
Okay.
Good morning. I will turn off my bleep. You can pretend. You can check your bleep in your hand and put in your pocket. I will turn off my bleep, my phone, and pretend put in your pocket. I will be in private room, one nurse with me, and I will hand over my patients to my colleague, and I will check the notes. The examiner will give you the notes. Sit in front of the patient. Don't talk with the patient. Read the notes. I will read the notes. When you are reading the notes, wait for 30 seconds. Is that clear for you, Dr. Gul?
Yeah.
Please, here also, wait for 30 seconds. Okay?
Okay.
After that, look at the patient. When you go inside, when you are reading the notes, don't ignore the patient. You did not see the patient yet.
Okay.
Even you are in front of the patient, no worries. It will not be against you because you did not greet the patient. It's not logic to greet the patient after that read the notes, right?
Yeah, yeah.
So until now, at any station, if you did not greet the patient, if you did not say, for example, I am Dr. Gol, I'm the most senior here, and may I know your name and age, please? This you cannot interrupt the patient. Once you greet the patient, don't do anything else, right?
Yeah.
But until now, you did not greet the patient. It means you are going to the notes in other room, you check the notes, and after that, you went to the patient. Did you get my point?
Yeah.
Okay. Can you do that?
So, sorry, Dr. Hani. So after reading all the information, I will just wait for 30 seconds, huh?
Yeah, wait for 30 seconds and pretend. Check the notes by your eyes, by your finger, and show expression also. You are sad. I want you, your eyes, your facial muscles act, go up and down. Okay, I want to feel that you are reading really and you are sad. Okay.
Okay, I will try from because I just get stuck here.
Okay. In the exam, the examiner will check your expression, and always your eye contact should be from 0 minute to 7 minute or 8 minute. Okay. So here you have to just verbalize because I cannot see you. Okay. So just mention, I will check the notes, and I want you to wait for 30 seconds. Don't talk. After 30 seconds, greet the patient and confirm the age and continue. Okay.
Okay, okay,
Yeah, you have six minutes. You can start.
okay. Good evening. I will ensure the department is safe and handed control of department to senior. Will close my mobile in a private room and one of nurse with me. And I will check notes, knowing that I'm fully aware about patient condition. So, so I start, Dr. Hani now?
Yeah, you can start.
Okay, sorry. Good evening. My name is Dr. Gul, one of ED registrar. May I know your name and relation to the child, please?
Yeah, I am the mother. Where is he now? Where is he? Is it okay?
Yes, ma'am. I can explain.
Please tell me, please.
Yes, ma'am. I can explain you everything. Would you mind if we will sit in a private room and I can discuss about his condition and one of nurse with us? Would that okay with you?
Okay.
Ma'am, before starting our conversation, would you like to have something?
No, please tell me what happened.
Yes, ma'am. I can explain you everything. Please, ma'am, have a seat, please.
Okay.
Ma'am, I'm so sorry that you're here today. Could you please tell me more about his condition?
Yeah, in the morning, he went with his friends and to the river, and they called me. He was drowning, and they called the ambulance. After that, I don't know what happened. Please tell me.
Yes, ma'am. I will explain you everything. Would you like me to explain about his condition a bit more?
Yeah, please.
I'm sorry, ma'am. I have a very bad news for you today. Your son brought to emergency by ambulance in a very critical condition after his friend found him drowning in the river. His heart was not beating, he was not breathing, and our team tried to resuscitate him, but unfortunately, ma'am, he died. I'm so sorry, ma'am.
Died?
Ma'am, have a
Are you sure? Are you sure? Are you sure? Can you check him again, please?
Ma'am, I'm so sorry. But unfortunately, he died. Do you understand what I'm telling you? I'm sorry, ma'am. Would you like me to explain more?
Okay.
Actually, ma'am, your son brought to emergency in a very critical condition. His heart was not beating, he was not breathing. And we immediately shipped him to resuscitation area and involved all the specialty needed in such condition. We passed a tube in his airway and connected him with a machine and gave him all the medication and did all the blood testing. And we did resuscitation for him for 1 hour. But unfortunately, despite of our all effort, we couldn't bring him back. And unfortunately, he is died. I'm so sorry for your loss today, ma'am. Ma'am, would you like me to call someone? Your family, your friend?
Yeah, I want to call his father.
Okay, ma'am, I will ask the colleague to arrange for that. Ma'am, do you have any kids at home? So we can bring them here?
Yeah, his brother. Yeah.
Okay, ma'am, for sure I will check social service regarding this. Ma'am, you want to see him, to touch him?
Yeah, please.
Ma'am, just give me a few time so I can make sure that area around him is clean and all the equipment that needed for resuscitation removed. So when you will go and visit him, you will not feel scary. So ma'am, I would like to tell you, like, as his cause of death is not known, so we have to involve coroner in such cases. Would that okay with you?
Okay, okay.
Ma'am, do you have any religious belief? So we can arrange a religious feast?
No.
Ma'am, I want to discuss about you regarding one issue. I know it's not discuss that, but it's a question that I used to ask from all of my all of people having such condition. Would that be okay?
Okay.
Ma'am, did he register in organ donation website?
Yeah, I registered for him.
Ma'am, so I would like to ask you, so you want to donate his organ?
Yeah, no worries, no worries.
Thank you, ma'am. By doing this, you're helping so many kids that die every year with organ failure. And I know your child will also happy when you will do that for him. So, ma'am, I would like you to see your son now. And I will contact Braveman office. So they will arrange a funeral arrangement and give you that certificate. So do you have any other concern, ma'am?
Thank you, Dr. Don.
Okay.
Okay, amazing, excellent. Okay, so I think the approach is clear now. Okay.
Yes.
Okay, so ignore the patient, greet all because you just saw them. Greet all here, it means you are a candidate and she is actor and he is examiner. You are not greeting the actor because a patient, okay? The first
Okay.
greeting, you are greeting them because we are human in the start. But ignore the patient. You did not see the patient yet. After that, you can do the introduction. Okay. The new update before in previous exams, we are telling the patient, does he have any organ donation card? Then the new law now, NHS website, you can check all people in the UK have two options only: registered to donate or registered to not donate, as you did today. Excellent. Okay, so all people can register, whatever, register to donate or register to not donate. It's not a big issue, but all of them should register. Children cannot register for themselves, but parental responsibility can register for them, right?
Yes.
So the mother or the father, if they have parental responsibility, they can register for them, whatever, to donate or not to donate. So the updated question now regarding this station, I want to ask you, don't say a long introduction regarding organ donation.
Okay.
Just mention one point. I'm sorry. I know it's a difficult situation for you, but I want to ask you a routine question in such a case. Does persons have a registration for organ donation? Okay. Registration here, it means whatever to donate or not to donate. Okay. So
Yes.
she can say, yes, he has registration to not donate. Stop. Or she said he has registration to donate. So you can continue. Would you like me to arrange appointment with organ donation coordinator? Clear, Dr. Gold?
Yeah, clear.
Yeah. Okay. And in the end, don't say, I will leave you and at any time you can call me. I'm here, I'm beside you. No. In the end, your support for the patient until she see the patient. So now we can go to persons and you can see him and I will arrange all papers for bereavement and. Well done, Dr. Go. Well done.
Thank
Amazing.
you, doctor. Thank you.
Dr. Any one question?
Can I add something?
Yeah.
It's now everyone is automatically registered for organ donation. You can register to opt out, but
Yes.
automatically everyone in UK is expected to be the organ donor.
Yes.
Unless you register that you don't want that, then
Yes.
this is
Yes. Okay. Any other question, guys?
One question, Dr. Any.
Yeah.
Just regarding breaking bad news, if we are telling in the beginning that I'm sorry, I'm having bad news for you, and then we are telling that your baby was brought here and explaining, so it is taking a lot of time. So
Yeah. Actually, I have commented to Dr. Gold. You remind me. Good. Thank you. If the patient is interested to know about the condition, don't say, would you like me to explain more? Because you are wasting her time. In any breaking bad news, whatever died or going to die or serious diagnosis, whatever you are talking to the patient or to the relative, here you have to check if the patient is ready to receive information or not. Until now, some people, they don't want to receive any bad news, right?
Yeah.
So you have to check that. How maybe he's silent. Maybe he's silent. So if the patient is silent, you have to ask him, would you like me to explain about the condition? If he said yes, you can proceed. If he said no, stop. Okay. And also, if the patient, you give him the first piece of information, maybe he want to stop at any time. Okay. So breaking bad
Okay.
news is not accepted by all people. Okay. Anyway,
Okay.
if you find the patient, please tell me what happened. Where is he now? It means already the patient want to know. Okay. So don't waste his time. Don't prolong the issue. No need to say, would you like me to tell you and so on. Okay. This
Okay.
is important point. And also you have to start. How much do you know so far? I think you did this one. Excellent. Okay. So I'm telling all people, you have to start, how much do you know so far about his condition, okay? And try as much as you can to shorten the first shot. He was drowning with critical condition and his heart not beating. Unfortunately, he died. Done. More than enough. Okay, Dr. Gol?
Yeah, doctor.
The first shot, try to make very short as much as you can. The second shot, you can go in details on why. Okay?
Fine.
I think is this your point, Dr. Abdullah?
Yes, thank you so much.
Okay. But anyway,
Dr. Hani,
yeah.
If they say that we don't want to know much more details, so what should we do at that time?
If they said what?
If they say that we don't want to know more details, as we say to them that do you want to know more?
Unlikely in the exam.
Unlikely.
Don't worry. Okay. Who else? Dr. Abdurrab, your turn.
Yes.
Okay. So checklist will be the same in all. Setting and acknowledge the loss, first and second shot. And you have to pause. Here, I have one comment also to Dr. Gol. You have to offer tissue and water. But you will offer tissue and water while the patient is crying or after he finished crying?
While he's
crying.
crying.
After crying. Okay?
Okay.
Always let the patient to express himself. Don't interrupt. Okay? After he finish, it means he is ready to listen to you. Ready to listen to the information and ready to listen to water and the tissue also. Okay? So 5 seconds and then she will look at you. After that, give her tissue and water. And here, when you are giving her tissue and water, it doesn't mean you will hold the tissue. Even you have tissue beside you, just pretend that tissue in your hand and give her, and your eyes in her eyes. Okay? Can you take tissue, please? Can you take some water? Done. Even you don't have water in the station. Okay?
Okay.
Okay. And the further support and action in all stations. Here, Corona, it's very important. So first of all, the family. Number 2, children. Number 3, the religious. Number 4, the coroner, if applicable. And also organ donation. We updated this one. Sorry, this slide is old. Okay. Dr. Abdurrab, your turn. You have 30 seconds.
Okay, sir.
You have 30 seconds and then 6 minutes.
Good evening, all. I will wash my hands and wear PPE. I will ensure that the department is safe. I will switch off my phone. I want the senior nurse to attend with me. I will go through the notes of the patient. Good evening. I am Dr. Abdurrab, EDO registrar. May I know your name and relation with Jack, please?
Yeah, I'm mother.
Hi, good evening. Did anybody attend with you?
No.
All right. Would you mind we sit in a private room so that we can discuss more about Jack's condition?
Yeah, please. What happened to him?
Yeah, I will inform you everything regarding the Jack. Before we start, I would like to offer you a drink.
No,
Is
I
it
don't
okay with
want.
you?
No. What about him now?
I am really sorry you are here today in this condition. May I know what do you know so far about Jack?
Yeah, he has cerebral palsy condition before, and the other day he was admitted in ICU, and they said he's okay. What happened?
Yeah, you're right. He was brought in a critical condition. He was having fits. Our team tried to resuscitate him, but unfortunately, I have a very bad news for you. He died.
Died.
I will offer a tissue and a water.
Are you sure about that? Can you check again?
Hello.
Can you
I
check
am
again?
really sorry. I am really sorry. Your son, Jack, has died. Do you understand what I am saying?
Yeah.
Jack, 1 year old, was brought into the emergency department and he had an episode of a seizure and he was admitted into a ITU where he was resuscitated and we put him on a ventilation. He was seen by the senior neurosurgeon. Even after all the efforts, we tried to save him, but unfortunately, his heart didn't, unfortunately, we couldn't save him. I'm really sorry for your loss. Do you want any one of your friends and families to be here with you right now?
Yeah. Call his father.
All right, I will make an arrangement so that his father will be here. Do you have any children at home so that you want them to
Yeah.
be here right now?
Yeah. 2 children.
I will inform the social services and they will bring him here. Miss, do you want to touch your son?
Yeah.
All right, give us a moment. We will try to clean the surroundings and we will remove the equipments so that you can see him properly. Do you have any religious belief?
No.
All right, Miss, this is a routine question. We do ask everyone. Has he made an organ donation? He has a register for an organ donation.
No. I register for him to not donate.
All right, that will be fine. All right, Miss. I will let you now to see your sons. In the meantime, I will be informing the bereavement department. They will help you to prepare they will help you to support with the paperwork and the funeral arrangement. Do you have any question for me right now?
No, thank you.
Thank you, Miss.
You still have 22 seconds. Okay, thank you, Dr. Abdulrahman. Well done. Okay. What do you think, guys? What do you think, guys?
Well done.
Perfect, I think so.
Okay. Okay. For me, it's amazing. Okay. Here, I have only one comment. Always try to fix this word in your conversation. I know it's difficult situation for you. I'm sorry for that. So don't say, fine. I said I registered to not donate. You said fine. It's not logic here, right, Dr. Abdullah?
Yeah, right, Dr. Hani.
Yeah. So take care, okay? Don't say fine or anything here. So if she said I registered for him to not donate, just stop. No need to comment. Just if you want to comment, you can say, I'm sorry, I know it's a difficult situation for you. No worries. The most important, always good eye contact in this station. Okay. And in the end, don't say to her, thank you. Don't say to
Yeah,
her,
right.
thank
Yeah,
you.
right.
You have
Yeah,
to
right, Dr. Hani.
continue with her until the time finish. Okay. So you can talk with her until the time finish. Do you have further question? No. Still you have time. You finished your station and you still have time. Do you think is it logic to say to her thank you and still in front of her 30 minutes, 30 seconds? You are not talking? Not good, right? Right, guys?
So, Dr. Hani, we will, for example, if this happens, so we stay there without talking, right?
No, talk. Don't if you still have time, you can use this time. You can get extra marks. Maybe you forgot something, right?
Mm-hmm.
So, for example, in your station now, you ask her, do you have any question for me? She said, no, thank you. Don't say, thank you, I will go, or no. Just to continue, I know it's a difficult situation for you. We are here to support you. We are here to help you. I will let you to see him, and also we will call for your husband, and he will be here and he will support you. So you have to continue, okay? Don't stop.
Yeah.
It's not logic. You are waiting in front of the patient in any station, whatever history taking, or you can chat, okay? But chat with the same approach. If you are chatting for history, you can chat with the accelerated tone. If you are chatting with the patient with depression, you can decrease your tone. You can lower your speech, okay? With good eye contact. If you are chatting in breaking bad news, keep your tone, whatever the station, okay? Whatever it's fast, whatever it's slow, whatever with high pressure, whatever with low pressure. Clear? Okay.
Right.
Yeah.
Dr. Hani,
Yeah.
Assalamu alaikum. I have a question. Regarding the registration for the organ donation, if the parents say the child has not been registered, so we will stop there, or we have to convince the parents.
Not registered at all.
Yes.
You mean not registered to donate and not registered to not donate? You mean that?
Yes, not registered to donate.
It's by law should all be registered automatic, okay? But anyway, if she said not registered, so you have to ask her for option. So what do you think now? If you will register to donate and not to donate, which one you will choose? Be clear with her, okay?
Okay.
Yeah.
If they won't opt for the donation, then we will stop there.
Again, please.
If we give the option for registration and the parent says no, we don't want to donate, so we don't convince or give some reasoning. No.
No, it's a no. Don't force anyone for anything. Okay. So
Okay.
I will guide you. To the website to register whatever to donate or to not donate. Done. More than enough. But it's unlikely to be like that in the exam.
Thank you.
Welcome. Okay, next one, Dr. Sameh.
Dr. Hani,
Yeah,
can I just share an experience with you? It's again about finishing early in these kind of stations.
yeah,
Unfortunately, I did the MRCEM exam in November,
yeah,
and I had a bad experience with this breaking bad news.
yeah.
Unfortunately,
What was the station? What was the station?
It was a 55-year-old lady who basically she had a massive intracerebral bleed, and her husband was there. Again, I didn't anticipate this. They gave me like 2.5 pages of notes to read inside inside the OSCE.
Sometimes 3 and 4 papers.
Yeah, it was so, because that takes so long to read.
Yeah.
And then unfortunately I forgot these because of the pressure. I forgot about asking about a priest or asking about organ donation. There's other things. If you run out of things to say, then you can also say, look, I realize this is a very stressful situation for you. I'm going to be on duty till 10 p.m. The senior nurse will be around. If you remember anything or you want to ask anything, then please, just ask the nurse, and I can come back and answer your questions as well.
Yeah.
So I think that's a different approach. And I think with regards to the organ donation, I think you should ask. They call it either opt-in or opt-out. So you can ask them, did you opt out of organ donation for your child?
Yeah.
That's all I just want to share that.
Yeah. Thank you. So here regarding the station, sometimes also the patient is contraindicated for organ donation. So you have to check after the session, guys, for contraindication for organ donation. Okay, maybe the patient, for example, meningococcal septicemia. What do you think, guys? What do you think, Dr. Khan?
No, you can't. Not.
Not suitable. Dr. Hani?
Yeah.
In cerebral palsy, organ donation is okay?
What do you think, guys?
Yes, I think okay.
Cerebral palsy, you can donate, the heart, liver, and all these, cornea. These are.
Yeah, because it's not affected. Not affected.
But you can't donate the brain, of course.
Regarding the meningococcal septicemia, the patient has multiple organ failure. All organ failed already. So how we will donate? Okay. So anyway, try to keep your tone.
Please, Dr. Hani, in case of meningococcal septicemia, to mention that he can't be donated, or no need to mention the donation at all?
Yeah, good point. So at least to show the examiner that you understand. Okay. So you can ask him here. He has multiple organ failure, and it means all organs not working. And does he have any registration for organ donation? Because he's contraindicated to donate. Maybe he will ask about that. Okay. Or you can ask him, do you have any concern regarding organ donation? But for a special introduction, for sure, I want to discuss with you important point. It's a routine we are discussing in such a situation, and you can discuss that. But you have to verbalize to the examiner that it's contraindicated. Okay. If you don't want to mention that, no worries, Dr. Muhammad Al-Bahiri.
Okay.
Yeah. If I will be in this station, I will not discuss in meningococcal septicemia. Okay. But if he opens the issue, it means it's a marks for you, because the actor will not ask you about anything until he is instructed to do so, right?
Yes.
It means if he asks you about organ donation for a reason, for marks, If you answer properly, you will take mark. If you will not answer properly, it will decrease your mark. So you can discuss with him. Okay.
Okay. Thank you.
Yeah. Welcome.
Dr. Hani?
Yeah.
Regarding the issue that some of our colleagues mentioned, when I got a lot of information and a lot of notes, so how we can manage it? So could I scan it just even if I missed some information?
Excellent. Okay. The most important information will be in the scenario or in the notes?
In the scenario.
In the scenario. Okay. For example, the name of the patient, the age of the patient, the gender of the patient, and the situation of the patient. And after that, you will get further details in the notes. Okay. Sometimes it will be not clear if going to die or died, or the patient serious diagnosis or whatever. So you don't want 3 pages. No need for 3 pages, but pretend in front of the examiner that you are reading. Okay. What do you need? The events, only the events. Okay. So the patient, for example, arrest for how long? The patient arrest how many times arrest? Maybe 2 times, maybe 3 times arrest. Okay. And the patient, for example, after arrest, ROSC or not? Arrest and died, or arrest and ROSC? After ROSC, the patient is stable or not? Clear?
Yes. Yeah.
No need to read all. What do you need from the notes? So always like that. In any breaking bad news, check the events only. So what happened to the patient? Moved to resuscitation room or to ICU? This important point you will tell here, because if you don't know where is the disposition of the patient, you don't know the patient in ICU or resuscitation room, can you talk?
Of course no.
Of course not. But now, at least you have what important points you will check for. Okay, so age, gender, name, the disposition, where is the patient now, who saw the patient, neurosurgeon or cardiologist, the steps, what happened to him from the start and at least 1 hour. Okay, and what his condition now, and the prognosis, the patient will die or died, or he's not going to die but serious diagnosis. For example, he has weakness, paralysis, blah 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 blah. Clear, guys? These are the most important. You will check in the notes. It will be in the first paper, don't worry, not in the second or third, the first paper. Okay,
thank you.
Welcome. Next one, Dr. Sameh. Dr. Sameh. Guys, can you hear me?
Yes, yes, we can hear.
Dr. Sameh. I think I cannot hear you. Can you hear Dr. Sameh, guys?
No. No, we can't hear.
Maybe he has problem in mind. Okay, anyway, at any time you can fix Dr. Sameh, you can present later. Dr. Ahmed Al-Amin?
Yes, Dr. Hani.
Yeah, are you ready?
Yes.
Yeah, you have 30 seconds. You can start.
Okay, I'm going to wash my hand, put on my PPE. I'm going to make sure the department safe handed to a senior colleague. Any patient immediate safety concern have been addressed. The private quiet room is available. My plebe and phone is off. The nurse is attending with me to support the family. And I'm going to check any notes before seeing the patient. Are there any additional notes? Okay. Hello, sir. I'm Dr. Ahmed Al-Amin, ED registrar. I am the most senior in the emergency department. I believe there is something you wish to speak about regarding one of the patients. Is this correct?
Yeah, I'm her husband. What about her now?
Are you the husband of Mrs. Siham, 36 years old female?
Yeah,
Yes,
please
sir.
tell me what happened.
I am here to discuss with you the condition of your wife. But first, can we move to a private room and one of the nurses will be attending with us?
Okay,
Okay, did anyone attend with you, sir?
no,
Okay, so sir, can you please have a seat? Can I offer you a drink or anything else?
thank you.
Sorry that you had to attend the emergency department. So can you tell me what do you know so far about Mrs. Saham's condition?
Yeah, they called me. They said she has road traffic accident and she is in critical condition, but I don't know what happened. Can you tell me, please?
Yes, sir. Actually, Mrs. Siham, she came to us in a very critical condition. She was not breathing and her heart stopped. We tried to resuscitate her. Unfortunately, it wasn't successful, and your wife, Mrs. Siham, died.
Right.
Let me offer you some tissue, sir, and a cup of water.
Thank you.
I'm so sorry for your loss. Would you like me to explain a bit more about what happened to her?
Yeah,
Yes, actually, she was involved in a major road traffic accident, brought to emergency department. Her blood pressure was very low and she was in a coma. We intubated her. She was seen by the consultant of the neurosurgeon. We were told that he said that she is a big bleeding in her brain. Unfortunately, while we were resuscitating her, her heart and breathing stopped. We continued resuscitation, involved all specialties, gave her all medications and did investigations for her. However, unfortunately, we were unsuccessful and she died. I am so sorry for what happened to your wife. Sir, do you have anyone you trust, a family member or a friend, you wish us to contact him to attend with you?
yeah, my brother.
Okay, I will let one of my colleagues to arrange for that and contact him. Do you have any children at home that needs to be looked after?
Yeah, 2 children.
Okay, I will call the social office in order to send someone to bring them here. Sir, do you have any religious beliefs? You wish me to involve a religion minister?
Yeah, I am Muslim.
Okay, let me arrange for that. Would you like to see your wife and sit
Yeah,
with her?
please. Yeah,
Okay, let me arrange for that. I'm going to ask the medical team to clean the area and remove any equipments there so that the scene will not be unpleasant for you. Sir, as the death of your wife was not natural, in such cases, we have to involve a coroner. Would that be okay with you?
okay.
Okay. Sir, actually, there is one question we ask routinely in such conditions. Please do not be offended. Is your wife registered for organ donation?
Yeah, she registered to donate.
Okay, sir. Let me arrange that with the organ donation office. Now I'm going to let you see your wife. I will also contact the bereavement office. They will provide you with advice and practical support, like the funeral arrangement, death certificate, and other papers. So do you have any immediate questions for me now?
It's my fault. I know, my fault. She asked me to drive here, but I said I am very busy. It's my fault.
No, sir, it's not your fault. It was just an accident. This is what happened. You don't have to blame yourself for that. I'm so sorry for your wife. I'm so sorry for you. Do you have any immediate questions for me, sir?
No.
Okay. Anyway, if you have any questions later on, I will be available in the emergency department. You can ask one of the nurses, and then I will come back and explain anything for you. Is this okay with you?
Thank you, Dr. Ahmed.
Thank you, Dr. Hani.
Okay. Well done. Amazing. But in the end, no need to leave the patient. I don't like that. Okay. In the practice, you can do that, but for the purpose of the exam, no need to mention that. Okay. You can say, I will let you now to see and touch your wife. Okay. Just mention that.
Okay.
Yeah. But if you will say, I will give you my number and means you are coming to support him. At least show the examiner that you came to support the patient. Okay.
Okay, Dr.
Yeah, just this is only one point. But anyway, if you will mention that in the exam, no worries. But I don't like. Okay, for me.
Okay. Thank you, Dr.
Welcome.
Dr. Han, you can hear me now?
Yeah.
You can hear me now?
Yeah, Dr. Sama.
Yes,
you can practice the next one. Who's
Okay,
talking, Dr. Abu Yahya or who?
So in practice, and this word also I think we can use in the exam, that there was always a staff nurse with us when we breaking the bad news to the family, and we leave the staff nurse with the patient because she will give them the leaflet for the bereavement office, and she will be with them as a support. So you can leave and say that the staff nurse will be with you, and she will continue to support you. And if you have any question, the staff nurse can ask me, and I will come back and answer any further question.
Yeah, and in the practice we are doing like that. But I said in the exam, for the purpose of the exam, no need to mention. So at least they mention I can let you now to see and touch your wife, and the time will finish. Done. Okay. It will be better for the purpose of the exam. Okay.
Dr. Hani, one more question. When there is a CT, should we offer to the patient to show the CT?
Of course. If you have anything inside the station, X-ray, show him the X-ray. CT, show the CT. Okay, and take consent to show him. Okay, would you like me to show you the imaging? Maybe he will say no. If at any time you want to give him more information, take consent. Maybe once he listened to the first piece of information, he got blocked. Okay, he doesn't want to hear anything else. He doesn't want to see anything else, right? It can happen. So would you like to tell me a little bit more? At any time, if you want to give him more information, would you like me to give a little bit more? If you have any imaging, would you like me to show you the imaging? If you say, okay, show him. Maybe he will say no. Okay, don't force him. Okay, clear, Dr. Amjad?
Yeah, clear.
Dr. Hani, do we have there the real image, CT scan, I mean to say, or it's just from the notes, it will be mentioned the findings?
Here, you have to ask the examiner clearly. I need to check the notes, or you can say any additional notes, any imaging, both together. Maybe you ask about the notes, he will show you the notes only. Maybe you ask about the imaging, He will show you the imaging only. But anyway, it's unlikely to hide anything from you. Okay. Even you will not ask about the notes, he will show you the notes. The examiner is instructed to do that. Okay. Next one, Dr. Sama.
Yes, Dr. Hani.
Yeah, I don't know what happened with your mic, but no,
I don't know wallahi also what happened.
Okay, no.
Anyway.
Okay, are you ready?
I'm ready, Dr. Hani, inshallah.
Okay. Okay. You have 30 seconds to prepare yourself. After that, 60 minutes to start. You can start. You can start, Dr. Sam.
Hello, Dr. Hani.
Yeah.
Yes, okay. I'm knock the door, wash my hand, wearing my BBE, greet all, asking if there is any additional notes. If there is no additional notes, I will proceed to the husband. Hello, sir. I'm Dr. Sameh. I'm an emergency physician. May I know your name and your relation to
Please, Dr. Sam.
Yes.
Yeah, we will start again. Sorry, because you will get notes.
Okay, this is my point. Okay,
Yeah,
I will knock the door.
Please wait.
Okay.
Don't
okay,
be in a hurry. Don't be in a hurry.
Okay.
Okay. You will find the notes, and no need to say greet all. I want you to greet.
Okay. Good evening. I'm Dr. Sameh.
We can start from because I will adjust the. You can start from the beginning.
I'm knock the door, washing my hand, wearing my BBE. Good evening. Any additional notes? You are hearing me, Dr. Hani?
Yeah. The examiner will give you.
I mean, there is no note will be shown now. You mean?
You can consider these are the notes. Just wait for 30 seconds.
I get them.
Pretend that you are reading.
I'm reading the notes, moving my eye, just moving my finger also over the notes. Then I will proceed to the patient, to the husband. Hello, sir. I am Dr. Sameh. I'm an emergency physician. I'm the senior for today. May I know your name and your relation with Mrs. Sina?
Yeah, I'm Salim. I'm her husband. What happened to her, doctor? Please tell me. Is she okay?
I will tell you.
Is she okay?
I will tell you everything in a moment. Miss, can we going to the private area, and I will handle my bleep to one of my colleague and also my patients. And if you are not minding, one of the nurse will be with us. If that is okay with you.
Yeah, okay.
Please, sir, can you take a seat?
Okay.
Sir, can you tell me what you know so far?
Yeah, she was admitted in ICU in 2 days back, and she was okay. They told me she's okay. I don't know what happened.
That's correct, sir. Actually, Mrs. Sina admitted 2 days ago due to she's came to us brought by ambulance in a very critical situation, and we admit her at the ICU. And today she is collapsing again, and despite of offer to resuscitate him to resuscitate her, unfortunately she's died.
Oh, right.
She has died.
Are you sure, doctor? Are you sure?
Sir, may I give you this tissue and this cup of water? Do you want to know more about her situation?
Yeah.
Actually, she came to us in a very critical condition, like I'm telling you. Her blood pressure was very low, and also her conscious level is very low, and we immediately intubate her, and we run for her a CT scan. This CT scan review by our neurological consultant, and unfortunately, she is arrested and inspired to resuscitate her due to her unsurvivable condition. She has died. Is it that clear to you, sir? Sir, anyone attend with you today, or you want us to call anyone to be with you in this situation?
Yeah, call my brother.
Okay, sir, we will arrange that. Sir, any children at home you need us to take care of them?
Yeah, 2 children.
We'll let social worker contact with them, and they will be in safe hand. So you want to see your wife?
Yeah, please.
Okay, sir, let us just arrange the scene for you. We'll remove her from the machines that attach to her and remove all the tube to let the scene be tolerable for you, sir. Sir, as you know, Miss Sina, she have a multi-organ failure due to her current situation, and if she is registered in organ donation, unfortunately we are not going to follow this wish, because her organ will not be valid to be donated, unfortunately, for that. I'm sorry to tell you
She
that, sir.
registered to not donate, doctor.
Huh?
She registered to not donate.
I know about these things. She, according to her situation, will be difficult, and it will be impossible to let her organ be donated due to it will be invalid for the other person. And so, I'm sorry to tell you that. Sir, did you and your wife following any religious?
No.
Okay, sir, we will let the gravement office contact with you and to arrange for her ceremony. And also, sir, we need to let you know that we have a specialist here that help you to pass through this kind of situation. And I need to tell you, we are all here for you. So did you have any further question for me?
No, thank you.
So again, I'm telling you, I'm sorry for your loss, and make sure that we are here to help you to pass this difficult and dark situation. Now you will be seeing your wife within a moment. Just let us prepare the scene for you, and you will be seeing her and touch her again.
Thank
Okay,
you.
sir. Thank you.
Thank you, Dr. Sana.
Thank you.
Okay, well done. Okay, here I don't like, guys, even Dr. Ahmed Al-Amin mentioned that. I'm sorry for your loss. No need to mention about loss here. Just I'm sorry. I know it's a difficult situation, more than enough. No need to mention about loss. Okay.
Okay. Okay.
Yeah. Also, try to avoid medical terms. Even Dr. Ahmed Al-Amin, no need to say intubated. Maybe he doesn't know intubated. Okay. We insert
Okay.
at you in her airway to
That's
help
fine.
her
Well,
to breathe.
to breathe. Okay.
More than enough. Okay. Regarding CT, we did
Brain imaging.
Which is called CT, and this was reviewed by the consultant neurologist or whatever. So anyway, anything mentioned in the notes, it will be guiding you.
Okay.
Believe me, guys, in the exam, it will be very clear, okay? Because you will find all information in front of you, okay? Don't be in a hurry to go to the patient. If you are in a hurry to go to the patient and you are not concentrating in the notes, believe me, you don't have anything to tell the patient. But if you read the notes very well, it will give you confidence when you are talking to the patient, okay? With the same station. Okay, well done, guys. We will go for the next station.
Thank you, Dr. Hani.
Welcome, Dr. Sama. Okay, next one. Dr. Fayo,
Hello, Dr. Hani.
how are you?
I'm fine, thank you. How are you?
Fine. Okay, you have 30 seconds. Prepare yourself.
Okay.
You can start.
I'm gonna lock the door and wash. Good evening. I'm gonna wash my hands, wear PPE. To make sure the department is safe, I'm handing over to the senior colleagues and ensure that my phones and beeps are off, and search for a private room and a senior nurse available. And I'm gonna look for any additional notes or imaging or ECG and review them for a few moments. Hello, good evening. My name is Dr. Pugh, ED Registrar. May I know your name and relation to the Mr. Cat, please?
Yeah, I am Seren and I am his wife. What happened to him, please? What happened?
Mr. Serin, nice to meet you. I'm here to explain everything about regarding your husband. Would it be okay if we move to a private room and discuss about in detail, and a nurse will be attending with us?
Okay, please tell me.
Okay, I'll explain everything to you. Please have a seat. Before we start, can I offer you anything to drink?
No, what happened to him, please?
Yeah, I'm sorry you have to be here today. What do you know so far about your husband condition?
Yeah, they said he has severe chest pain at work and he was collapsed at work. They called the ambulance and they brought him here. What happened to him, please? Is he okay?
Yeah, you're correct. Yes, you're correct. I'm sorry, I have a very bad news for you. Your husband was brought in by ambulance with a critical condition with a severe chest pain. The medical teams resuscitated him, but her heart was not beating, and so unfortunately, your husband has died.
Oh. Are you sure, doctor? Can you check again?
Yeah. Can I offer you tissue or water? Mrs. Serene, I'm sorry. Unfortunately, your husband is died. Do you understand what I have explained to you? Yeah. Mrs. Serene, your husband was brought in by ambulance due to a critical severe chest pain, and our team has resuscitated him, and we give him all the necessary medications, and we also give shock for his chest arrhythmia. I mean, his heart was beating abnormally, which is shown in her ECG. So we give him shock multiple times, and we give him all the necessary medications. Unfortunately, all the efforts, he has died. Do you understand, Mrs. Serene? I'm really sorry about your husband. Do you want anyone to attend with you? Can I call someone for you?
Yeah, my brother.
Okay, I'll let my colleagues know to call for him. Do you have any children at home so that we can bring them over to you?
Yeah, I have two children.
Yeah, I will let the social services know, let them know to bring them over to you, okay? Would you like to meet your husband and touch him?
Yeah, please.
Yeah, so please give us a few moments so that we can arrange for you. So all the equipments attached to him be removed so that the scene will not be scaled to you, okay? Do you have any religious belief so that we can arrange for that?
No.
Okay. Mrs. Serene, I'm sorry to ask you this question in this kind of situation, but we ask these questions to everyone in this situation. Did your husband register for organ donation?
He registered to not donate.
Okay, I understand that. Okay. So I will let you see him in a few moments. Do you have any immediate questions for me?
It's my fault. In the morning, he told me he has chest pain, but I thought it's muscle pain. It's my fault.
No, Mrs. Serene, it is not your fault. This can happen to anyone at any time. It is just a medical problem, so it is not your fault. So don't be sad, okay? Okay. Would you like to see your husband now so I can let you see him?
Okay.
Yeah, so in the meantime, I will contact the bereavement office to offer advice and arrange for the funeral also, and also prepare for the death certificate and paperwork too. Okay. Do you have any other questions for me or any concern?
No, thank you.
Okay, your husband is on the way to support you, so please don't be sad. And everyone here is to help you, okay?
Okay. Okay, thank you, Doctor.
Thank you.
Yeah.
Thank you, Dr. Honey.
So, what do you think?
I'm not sure.
Okay. So, regarding this station, you did very well. Okay.
Thank you.
Here, just give me 1 second. I will do this one. Okay. Well done. Here, I just want one comment. When I said, is he okay? You said, yeah. So take care from these things, okay?
Yeah, okay.
You said, yeah, again. Okay. So if the patient said, what about him now? Is he okay? Don't comment, just mention, we are here to support you. We are here to help you. We are here to discuss about him. Would you like to sit in private room and one nurse with us? Have a seat, please. Would you like to offer you anything to drink? No, no, I don't. Okay, how much do you know so far? Blah, 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 blah. Please try to concise the first shot. Okay, Dr. Faye?
Okay, Dr. Honey.
So you have only 15 minutes. Otherwise, amazing. Okay?
Thank you, Doctor.
Welcome. Okay. Dr. Omar?
Yes, Dr. Ani.
Yeah. Are you ready?
Yes, Dr. Yes.
Okay.
Okay, this station miscarriage in lady in vitro fertilization. Here, this station, is it communication or history taking, guys?
Communication.
Okay, so I will change the slide, but I will change the pie chart. Dr. Omar, your mic is noisy. Try to fix it, please. So I will change the pie chart and I will change the task. Can you see? What about this now? Guys.
Both. Both history taking and communication, right?
So which one you will start with?
History taking.
Okay. So here history taking communication and here take a history and explain the situation to her. It means you will start by history and then you will communicate with the patient. Okay. But this one, it's a communication only, right? After that, in the end, you will give her the management plan. Clear, guys? Don't be confused in the exam. Everything will be clear, but follow the steps. So here, number one, pie chart. Number two, the task. Number three, the scenario. Also this one, pie chart, task, scenario, from down to up. In any exam like that, written or practical exam. Okay, Dr. Omar?
Dr. Hani, just a question. Will it be like explaining a new diagnosis, for example? If the patient is anxious first to know about the result of her ultrasound, shouldn't we, for example, in the beginning, explain to her about the situation and then continue taking the history if the station becoming a history?
Yes, it's like new diagnosis, but breaking bad news.
Yes, yes. I mean to start first by the eyes and start to explain what happened. And
Number
then take
one, number one, break the news. So the same setting, the same introduction for breaking bad news. After that, you ask about concern, right?
Yes.
After that, resolve the concern and give her the management plan.
No, no, I mean when it is history taking.
If history, so here you can inform her about the result, but without breaking bad news. Okay, you just show her empathy. Okay.
Yes.
So no need to wait for time, no need to give her tissue, no need for these things. Okay, but at least show her empathy. Okay. And then you can ask her about eyes and you can check her concern. And after that, give her the management plan will be in the end. Take her also brief history, like can you tell me more what happened? And also past medical disease, past surgery, and. Okay, brief.
Okay.
Okay. So in a way, always follow the pie chart. The pie chart is the key to pass the station. Okay. Okay. One will do this station and one else will do this station. Okay, guys? Okay. Dr. Omar?
Yes, sir.
You will do this station. You have 30 seconds.
Can I start?
You can start.
Good morning. I need to wash my hands and wear PPE. I would ensure that department is safe and is over control of the department to my senior. My phone now bleep off.
and member of nursing staff present to support. And I would be fully aware of the patient details and additional notes. Any additional notes? Good morning. My name is Dr. Muhammad Umar, EDZ Squad. May I know your name and age, please?
Yeah, I'm Hadil. I'm 28 years.
I have been informed that you are 13 weeks pregnant. Is that right?
Yeah,
Did anyone attend with you?
no.
Would you mind if we sit in a private room to discuss about your results and the staff nurse attend with us?
Okay.
Mrs. Hadil, are you comfortable now? Do you have any pain?
I'm okay.
Can I offer you a drink or anything else before we start?
Okay.
Okay, Ms. Hadil, have a seat, please. May I know what do you know so far about your pregnancy condition?
Yeah, I'm pregnant 13 weeks and um I have vaginal bleeding last night. I came here today to check um for my baby.
That's correct. Would you like me to explain a bit more about your results?
Yeah, please.
Okay, Mrs. Hadil, I'm sorry, I have a bad news for you. As according to the results, your baby does not have a heartbeat. Please have a tissue and water, please.
So what do you mean by no heartbeat?
Mrs. Hadil, I'm sorry, but your baby is no more. That
What
do
do you
you
mean by
understand
no
what I
more?
have? The baby is dead.
Dead?
Yes. Do you understand what I have said? Please have a tissue and water.
Can you check again, doctor?
Uh, as we explained, the results are confirmed already, and I know it's a difficult situation for you to understand, but that's the truth. Your baby is dead. Do you want to call anyone?
Yeah, I want to call my husband.
Okay, I will arrange for that with our colleague. I know it's a very difficult situation for you, but do you have any immediate concerns about it? I have been informed that it is your first pregnancy. Is that right?
Yeah.
Which was the natural or assisted conception?
Yeah, it was in vitro fertilization.
Mrs. Patel, we are here to help you. We will discuss your results with the OB/GYN team, and the decision will be yours regarding the further management, as you want to pass the tissue naturally or by taking the medicine or performing a procedure like dilatation and curettage.
This is my fault, I know. This is my fault. Yesterday, I have vaginal bleeding. I should came in the same time. Why I came late? It's my fault.
No, it's not your fault. It can happen in any situation. Even you come yesterday, also maybe results will be the same. So don't blame yourself for that. I encourage you go home and take your time to decide the further management and let us know how you want to proceed. But as according to your case, the one in vitro fertilizations, the spontaneous this one abortions are very common miscarriages. So just think about it and how you want to proceed and inform us regarding your decision. Do you have any further questions?
Thank you, Dr. Omar. What do you think?
So, little bit different station. The patient is in the sad state, but you have to address the further things also regarding the management explanation and further the concerns of the patient.
Okay.
So then it will not speak too much. The patient will not speak too much.
Sorry, Dr. Ram, to interrupt. I think they did very good. The only thing is the vague terminologies that you used at the beginning when you announced the death of the baby. I think this is the only thing that was maybe you just should have said that the baby was dead. Just simple.
Yeah.
You said there's no more, and then you said.
This is what I want from you guys. Don't make things difficult for yourself. When you are sitting with yourself at home, make notes. What will I say here? What will write? Okay. And don't take a long time to express your conversation. Communication skills, be ready. What will you say? Okay. So I am Dr. Omar. I'm the most senior here. May I know your name and age, please? Nice to meet you. Can we sit in private room to discuss regarding your pregnancy? How much do you know so far? Or how can I help you because she came for routine or for checkup? Okay. After that, would you like me to explain? Because she doesn't know. She has bad news. Okay. But other stations of breaking bad news, they have idea. Here, she doesn't know. Okay. So would you like me to explain about your results, ultrasound results? Yeah, please. I'm sorry. I have bad news. The ultrasound show no heartbeat and the fetus is dead. Clear, Dr. Omar?
Yes, okay.
Yeah, very simple. Don't make difficult for yourself. Okay. No need to say no more or no beat or. So be clear with it. Dead. If the station is died, mention died. If the station is going to die, mention going to die. And so on. Okay. Well done. Well done. Here, regarding the management, what will you do before any management, guys?
Eyes.
Eyes. Once you start the management in any station, eyes first. So what is your idea? What is your concern? What do you expect from us to do for you? Okay. Maybe she will say it's my fault, blah, 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 blah. I should come early. It's not your fault. Miscarriage is high risk in vitro fertilization. How you know it's in vitro fertilization? You should ask her first from the start before you ask her about ice. Okay, so if mentioned in the scenario about first pregnancy, no need to ask her about is it first or second. The examiner will think you did not read the notes. If mentioned in the notes and in the scenario, this is the first pregnancy, you can tell her, I check your notes, I found this is the first pregnancy with you. Is that right? Yeah. If mentioned in the notes in vitro fertilization, don't ask her. You have to inform her, I check your notes. The type of pregnancy is in vitro fertilization. Is that right? Yeah. So this is the first pregnancy. And here, once you go for the step of miscarriage, if she said, this is my fault, it's not your fault. Miscarriage is high risk in vitro fertilization. Okay. So, do you have previous miscarriage? Yes. So, what is your idea? What is your concern? What do you expect from us to do for you? Okay. So, her concern, maybe she will not get pregnant again, or maybe if she's pregnant in vitro fertilization again, this will happen again. So you have to encourage her, and you have to give her the management plan for OB/GYN and give her the options. Okay, well done, Dr. Omar. So the most important here, this is a checklist. No need to talk about any children at home because she doesn't have any children. She is fighting to get pregnant. No need to talk about religious beliefs. No need to talk about corona. Okay, and no need to talk about organ donation. Here regarding this thing, it's not applicable here. The setting the same. After that first shot, after that second shot, okay, and support. So you have to talk about OB/GYN also, and miscarriage in vitro fertilization is common compared with spontaneous pregnancies. It's not your fault. Do you have immediate question? And here also, we are here to help you. We will discuss with OB/GYN team. You have the choice of waiting for tissue to pass naturally, taking medication, or performing dilatation and curettage procedure. Okay, so it will be a direct station, but just to follow the steps. Okay, who is next? You will do the same station, but different approach. Doctor.
Sorry, Dr. Hani, just I can ask you one question.
Yeah,
no
sure.
need for tell her I will shift you to observation, we'll do for you some examination, we'll run some blood tests like this, or
it means
because
you did not read the scenario. No pain or medical problems.
Okay.
Okay. So here your task communication skills. Okay. So here the patient is medically free. No need to do anything. Just explain to her and break the bad news. Okay. Okay. So yeah, after that you will give her support from OB/GYN team. Even the next step, it's not your duty. Regarding the tissue in her uterus, it's not your duty. Okay, it's a duty of OB/GYN. Even you will give her support, psychiatric support, no worries. Some people prefer to add in the end, would you like to offer psychiatric support for you? Just to take consent, maybe she will say yes. Okay, so anyway, just to follow the steps. Dr. Raji?
Hello, Dr. Hani?
Yeah.
Sorry, one clarification. For the breaking bad news, at the beginning, everybody is saying I would put up my phone, I would put up the bleep. In the exam scenario, is it same like this, or we have to mention it, or we have to act it? How does it come in the exam? About the phone and the phone and the bleep.
Yeah.
this what I did, and this what our students did before, and we got 10 out of 10. Okay, so
okay,
yeah, you have to mention that before you reach the patient or the actor.
okay,
Just verbalize. I need to turn off my belief, my phone, and pretend also. So just of course you will not have a phone. It's not allowed. So just
yes,
pretend that you are checking the phone in your hand. You are turning off and putting in your pocket. Pretend.
okay,
I will turn my phone off. I will ask one nurse to be with me. We are in private room, and I will check any notes or any imaging. Okay, the examiner
okay,
will give you, even you will mention or not, and
okay,
read them for 30 seconds. Okay, after that,
okay,
go to the patient.
okay, thank you.
Welcome. Okay, next one, Dr. Raji.
Hello, sir.
Yeah, we will do the same station, but it will be different by chart. I change your history and I change the task, the chemistry. Okay, so I will see what will you do.
Okay, sir. I'll try, sir. I'll try.
You have 30 seconds.
Okay, sir.
You can start.
I need to wash my hand, be my personal protective equipment. Hello, I'm Dr. Rajalakshmi, ED registrar. Can I confirm your name and age, please?
Yeah, I am Hadil. I am 28 years.
Nice to meet you, Mrs. Hadil. I have been informed to take some data from you. Would it be okay with you?
Yeah, please.
Are you comfortable now? Do you need anyone to stay with you?
I'm okay.
Okay. I have been informed that you have some vaginal bleeding last night. Is it right?
Yeah, yeah.
Can you tell me more about your symptom?
Yeah, this happened last night. I found some vaginal bleeding, and I used the pads. It was not stopping, but it stopped after like 6 pads, and I came here today in the morning.
I'm sorry about that. And it started last night and it was increasing and you were using pad and you came last night. Is it right?
I came in the morning.
Okay, sorry. You came in the morning. Okay. Does anything makes the vaginal bleed more?
No, I was playing in our flat, and this happened suddenly.
Okay. Do you had the similar symptoms before?
No, no.
Does anything makes it better?
Yeah, I used the pads and they stopped spontaneously.
Okay. Okay. Do you have any other symptom like tummy pain?
No, 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 I'm okay now.
Okay. Do you have any fever?
No, no.
Do you have any other symptoms other than vaginal bleeding?
No, 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 I'm okay.
Okay. Can you tell me when was your last menstrual period?
Yeah, I'm pregnant now, 13 weeks.
Okay. Before you were pregnant, the menstrual period was regular. Was it regular?
Yeah.
Okay. How was the flow? Is it normal flow?
It was normal.
Okay. Can you tell me how many children do you have?
No, this one in vitro fertilization, doctor. I don't have any previous pregnancy.
Okay. Okay. This is your first pregnancy. Okay. Do you have any other problem like vaginal discharge?
No, no.
Before diagnosed with a sexually transmitted disease or anything?
No.
Okay. Do you have any previous medical problems?
No.
Do you have any previous surgeries?
No.
Any recent hospital administration?
No.
Okay. Do you have any disease run in your family?
No.
Are you on any prescribed medication?
They are giving me medicine for this pregnancy to support.
Okay. What are the medications?
I cannot remember.
Okay, that's fine. Any allergies?
No.
Okay. Did you travel recently anywhere?
No.
Okay. Are you in a stable relationship?
Yeah.
Okay. I want to ask you some personal question for that. And where do you live and whom do you live with?
I'm living with my husband in downtown.
Okay. What do you do for your living?
I'm a teacher.
Okay. Do you drink alcohol or smoke?
No.
By any chance, do you use any illicit drugs?
No.
Okay. Tell me, Mrs. Hadil, what is your concern and what do you want from us to do?
Yeah, doctor, you are taking data from me. I want to know what about the result.
Okay, I can understand. I have reviewed your notes and I have your ultrasound report in my hand. Would you like me to explain?
Yeah.
Okay. I'm sorry, Mrs. Hadil. I have a bad news for you. And I reviewed your ultrasound scan. Your fetus has not having heartbeat and the fetus is dead. Do you understand what I have said?
Yeah.
I'm sorry, it's really hard for you. Do you have any questions?
Yeah, this in vitro fertilization. So how will I get pregnant now?
I can understand. This is more common in vitro. The miscarriage is more common in vitro fertilization than natural conception, but we can try again. So don't lose hope. We'll try again. And I'll refer you to obstetric and gynecologist department regarding your further management, whether we need to wait to pass the tissue naturally or give some medication or do some procedure to extract the tissue like dilatation and curettage. Is it okay with you?
Hmm.
Do you have any questions for me? Thank you.
Okay, what do you think?
I don't know, sir. I really tried.
Okay, what do you think, guys?
History is long, communication is less.
Okay.
So she must make short history, brief history, and then
Okay,
communication.
regarding this by chart, communication, how much?
60%.
60%. And history taking, how much?
10.
10%. Okay.
And even history, she's not concerning about presenting illness. She should be asking about the vaginal bleeding itself now, not about the period before, what is regular or not. Already she's pregnant now. What about her situation now? There is tummy pain. I mean, should be, I don't know. But I think better history presenting illness, then you proceeded with communication. Better than you asking about what before the pregnant.
Okay, which one to start? She kept the result to the end.
No, history, if we'll take history, sorry, 1 minute, Dr. Hani. If we take the history, we have to ask her that why you are here in hospital today and how can we help you? She will tell briefly. Then we'll go directly that what do you think is going on with you?
Eyes in the start.
Okay.
In the start, we will take the history that why, let me know why you are in hospital today and what is She will tell that I am bleeding like this, like this. Then the next question in history, that what do you think is going on with you?
Yeah.
These two questions, you can take brief history and then you can go for communication, like breaking bad news.
Okay. So first of all, you can do the same setting, no worries. Okay. And also, I have been informed that you have vaginal bleeding last night. Is that right? Yeah. Can you tell me more about that? Blah, 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 blah. Are you comfortable now? Do you have any pain? No. Do you have any other symptoms rather than vaginal bleeding? No. Done. Okay. So this for present illness to save time.
Okay.
Because it's a 10%, right?
Hmm.
Okay. So no need to talk about associated symptoms. Okay. And I have been informed, mentioned already in the scenario, no need to ask here, how can I help you? Okay. I have been informed that you came to do ultrasound. What is your idea? What do you think regarding the results? I don't know. Maybe she will say, is it miscarriage? Maybe she will say, I don't know. Okay. Listen from him. So Ice, what is your idea? What is your concern? Okay. What do you think about the results? She will say, blah, blah, blah. I'm sorry to tell you, according to the ultrasound result, it show no heartbeat and the fetus is dead. Just a brief breaking bad news. No need to prolong. Okay. After that, she will accept the issue. After that, you can ask her, what is your concern now? So concern maybe before and concern after. So two concerns here. Before the result, what is your concern? I'm worried. Is it miscarriage? So after you tell her the result, what is her concern? Her concern, will she be pregnant again? And even she will be pregnant again, she will get miscarriage again. Okay, and so on. So you can resolve her concern. Okay, and tell her the management plan. I will refer you now to OB/GYN team. They will support you, and we are here to support you. And. You will talk about all communication skills. After that, in the end, you can take brief history from him. I want to take more data from you. Any previous miscarriage, any past medical disease, any previous surgery, and also can continue the general approach of history. Okay. Is that clear, guys?
I need to do a communication first. First, I should ask concerns and explain the report, and after that, I need to take history taking. Is it right, sir?
Yeah. Finish everything before history taking. History taking. Just start by the introduction, and after you finish the communication, after you finish the management plan, the concern and the management plan, so you can take more data from here just for the recording. Okay.
Okay.
To be in her file.
Thank you.
Welcome. Okay. Next one. Dr. Tariq?
Yes, Dr. Han.
Yeah, are you ready?
Yes.
Okay, you have 30 seconds. You can start.
I will wash my hand and wear PPE. Department is safe. Hand it over to the senior. I will close my mobile and bleep. Senior staff is there to support the patient, and quite a private and safe location. I will read the notes. Start.
Can I start?
Okay. Hello, Mr. I'm Dr. Tariq, one of the senior doctor working in emergency department today. Can you confirm your name and relation with the patient?
Yeah, I am Nadia. I'm his wife. But please tell me what happened. Is he okay now?
Okay. Can we sit and in a private location? We can talk comfortably, and I can explain you.
Okay.
Can I get something for you?
No need, doctor. Please tell me what happened.
Okay. I'm sorry you are here today. And do you have understanding about the event that brought your loved one into hospital today?
They called me. They said he was collapsed, and they brought him here to the hospital. I don't know what happened.
Yes, you are right. Your husband was brought by ambulance and he was collapsed, as you told, as you know. He was in hospital, his GCS, he was very low, he cannot talk and he can the difficulty in breathing. And he stayed for some time and we try to resuscitate. But I have a dreadful news for you, that your husband died.
Died?
Yes, your husband died.
They said he's alive.
Can you explain me? Can I explain you more? You want me to explain more?
Sorry, Dr. Tariq. Guys, died or going to die this one?
Going to die.
Oh my
Going
God,
to die.
sorry. Oh, sorry. La hawla wa la quwwata. Okay, I will start again. I'm sorry.
Okay.
Continue from here.
Take care, guys. Take care. Here,
Okay.
once you find the breaking bad news in the
Oh
exam,
my goodness.
just
Yeah.
number one, check the patient died or going to die. Okay?
Yeah.
Please.
Okay.
This is a serious mistake. You will
Very
fail
good.
the station.
Yeah.
Okay? It means
Okay.
if you are working in the UK, you will do that.
Yes.
Okay.
So I will continue from same.
Okay, you can continue. But you are taking a long introduction in the first shot.
Okay.
Just wait, I will do for you. Okay. Your husband, yeah, you are correct. Your husband was collapsed in critical condition, and he has massive bleeding in his brain, and I'm sorry to tell you, he's going to die. Done.
Yeah. Okay.
Okay. So
No,
always
because in my
the
mind
first,
he died.
okay, you can start.
Okay. Can you tell me more about that? What is your understanding that your loved one brought into hospital today?
Yeah, they called me. He was collapsed, and the ambulance brought him. I don't know what happened, doctor. Please tell me. Is he okay?
Yes, you are right. Your husband collapsed, as you know. When brought into hospital, he was very in serious conditions, and we did seen by our specialist and resuscitation team. CT was done, but he had massive bleeding. So I'm sorry to say that your husband will die. You want tissue, please, for you, tissue and water? You want me to explain in detail?
Yeah, please.
As you know, your husband collapsed. When he came to hospital, he was not conscious and his GCS was 5.
What is GCS, doctor?
His conscious level was very low.
Okay.
We put the tube in his airway to maintain the airway breathing. And our neurologist came and he advised that we have to do the brain scan. Brain scan was done and seen by neurologist and contact with the CT brain specialist, CT specialist, scan specialist, and they found out that he has a massive bleeding and this patient will not survive and your husband will die. Do you understand what I said?
Yeah.
I understand that how difficult this news is to take in. Do you have any immediate question for me?
I want to transfer to another hospital, doctor. I cannot trust this hospital.
You know, Mr. As you know that our this is non-survivable. You will take anywhere in another hospital. There is the same treatment, and there is no survival. Do you understand?
So you mean the same management in any hospital?
Same management, yeah. Do you understand?
Yeah.
So what I said, can you let me know? Do you want, I have to call someone from home that will attend you?
Yeah, please call my brother.
Okay, I will talk to my social department. They will call him. Is there children at home?
Yeah, 2 children.
Okay, I will talk about them that they have to bring your children. And we have, do you have any religious belief?
No.
Okay, would you like to see your husband?
Yeah, please.
Okay, I will arrange for you. Then you can see, then I will take you and you can see and you can touch your husband. And do you have any immediate question for me?
No, thank you.
Okay, and I'm here because I'm in the evening duty and I'm all of the evening here. If you have any questions, know how small is that one. My staff is there. You can talk to her and she will call me and I will come here to explain you everything. Is it okay with you?
Okay.
Do you have any other question?
No, thank you.
Thank you very much. Oh, again, I say thank you. Still I have time?
You still have 1 minute. Okay, thank you, Dr. Tariq. Thank you. What do you think?
I think so that just only because of this, I make wrong things and accept. I think so. It's okay. I don't know. You can tell that what is missing there.
You know, I'm not worried about this station. I'm worried about other stations. If you are not reading the scenario, it means you are not reading any scenario, right?
Yeah.
So number one, check the pie chart. Number 2, don't care about performance. You are thinking about your performance. You are not thinking about what is the first step. The first step, the pie chart. Number 2, the task. I don't care what is inside the task. Number 2, the task. Number 3, the scenario. Okay. Number 4, preparation. Number 5, performance. But you are thinking about performance number 1, right?
What do you mean by performance?
You are thinking about what will you do. Okay, number one, no. If you will follow the steps, your performance will be professional. Okay. And before everything, you have to memorize the approach. Okay. All of us, we are telling how much do you know so far, but you are changing that. You are, what did you say? What is your understanding? Did we mention that? So number one, memorization of the approach. Don't change. Don't be different than your colleagues. Okay. No worries. It will not affect your marks. But number one, memorization. Number two, the pie chart. Number three, task. Number four, scenario. Number five, preparation. After that, the performance. Don't care about the performance. For sure, if you will follow the steps, the performance will be very well. Clear?
Yeah.
Okay. But if you will not read the scenario, how will?
Well, this big mistake. This.
Of course, it's not about dying or going to die. Big mistake. You are not reading the scenario, or not reading the pie chart, or not reading the task. Okay.
Yeah.
So inside the station, inside the room, you will always think what is inside that pie chart. Did you get my point?
Yeah.
All the time inside the room, if you did not read the pie chart or the scenario, you are thinking inside the room about the scenario and the pie chart. What is written there? So why you make difficult for yourself? Okay.
Okay. One thing I want to ask, that we have to ask here in going to die for organ donation or not?
Yeah. What do you think, guys?
We should ask.
Yes. We can ask.
Okay.
And what about bereavement office?
Yeah, if the patient has a serious diagnosis, for example, this patient has paralysis, weakness paralysis, and ischemic stroke, not hemorrhagic stroke. Okay, he's not going to die. So why you will do organ donation? Okay, it's not logical. But if the patient is going to die, maybe today, maybe tomorrow, maybe after tomorrow, right? So eligible for organ donation, right? Clear? Okay. So organ donation here, just registration. So at any time, declaration of this, so they will use the organs. Okay. Anyway, organ donation, guys, it's not a big issue in the Breaking Bad news. Don't worry. Even if you will not mention about organ donation at all, it's not a big issue. Okay. So here, did you show me the CT scan?
I did not offer you.
Why?
Forget.
Okay. Or secret? Okay. So please, guys, use anything. It's marks for you. So would you like me to show you the imaging? Yeah, please. So can you see this is the white, it's a bone, the skull, and this the gray one, it's the brain, and this is the white one. Can you see how much? It's a massive bleeding here also. And this is doing compression on the brain. And this scan was seen by consultant neurosurgeon. And I'm sorry. Can you see my tone, Dr. Tarek?
Yeah.
Okay. So according to the neurosurgeon, he said, unfortunately, it's not survivable and not operable. This make compression of the brain. That's why his conscious level is very low. And this affects his breathing and the airway. That's why inserted a tube to help him to breathe. Attach him to machine to help him to breathe. Okay, so always think about the steps, not think about the performance. Believe me, don't think at all about the performance. Okay, because if you will find any new station, if you will follow the same steps, the same general approach, believe me, everything will be smooth with you. Okay. Okay, I want someone to do this station again.
I will do, Dr. Hani.
Yeah, I can. Anyway, we will go step by step. Dr. Milleti, the next one.
Yes, I'm available.
Okay. Can you do this station again?
Yes, sure.
Okay. You can start.
Okay, good morning. I'll make sure that I handle the department to one of my senior physician colleagues. I will switch off my phone and I will take a moment to look at the patient notes before approaching the patient relatives. Good morning. May I know your name and your relationship to to John, please?
Yeah, I'm Nadia. I'm his wife. What happened to him, please?
Hi, Nadia. Nadia, would you please go with me to a private room so we can discuss the case of John?
Okay.
Would you like anyone to attend with you?
No.
Okay, I will let one of my NS member staff to attend with us. Miss Nadia, I'm very sorry that you are here today. What do you know so far about John case?
Yeah, they told me he was collapsed and the ambulance brought him. I don't know what happened after that.
Yes, that's true. I'm very sorry to hear that, Miss Nadia. Yes, so John was brought here because, as you said, he collapsed, he fell down. When we received him, he was on critical condition. He was not doing very well, actually, and his conscious level was low. We did a scan for his brain. His scan shows that there's a big amount of blood in his brain, and because of this, unfortunately, I will tell you that Mr. John will not survive and he's going to die.
Going to die?
I'm really sorry to say that, Miss Nadia, for you. Here, there's a cup of water and some tissue. I'm very sorry for you to hear that, Miss Nadia. So yeah, as I told you, when he arrived here, his conscious level was low. We had to put a tube inside his airway because he was not able to breathe. He was not able to control his breathing. And then his scan showed a lot of blood. I can offer you to show I can show you the scan of his brain if you want. Would you like to see the scan?
Okay.
Yeah, so this is Miss Nadia, the scan of his brain. Here you see this white thing. This is all blood inside his brain. You can see that the blood is occupying more than the half of his brain, and it's also causing some compression. This scan was reviewed with a neurosurgery consultant, and as I mentioned earlier, Ms. Nadia, he confirmed that John cannot survive and he is going to die. Very sorry to hear that.
Are you sure?
Sorry, Ms. Nadia, can you say again?
Can I transfer to another hospital, doctor?
Well, Ms. Nadia, I just would like to confirm to you that the management plan would be the same in every hospital. And I think that me and you will agree that it's better for for John to make him comfortable, as the management will not change either here or another hospital. Ms. Nadia, I can offer you a phone if you want to make any phone call, or if you want to call someone to attend here with you to support you.
Yeah, please call my brother.
Sure, I would let someone from my colleagues to arrange that for you. Do you have any children at home so we can bring them here to you?
Yeah.
Okay, so I'll let someone from my team to arrange this for you as well. So, Ms. Nadia, do you have any religious belief? Do you want a religious minister to be involved with you here to support you? Again, I'm very sorry that you heard all these things from me. Would you like to see John, Ms. Nadia?
Yeah, please.
Okay, just give me a couple of moments to arrange the scene for you. Now I'm gonna expect. I'm gonna want you to expect that he is connected to a lot of medical equipment, and I don't want you to get frightened from you seeing him like this. Ms. Nadia, does your husband have any wishes like organ donation?
He registered to donate.
Okay, and do you agree that we can send him for organ donation? I'm very sorry to tell you these things, Ms. Nadia. This is just a normal procedure that we do in every such cases. Now, your husband's organs can be used to help other people who is waiting for such organs. By taking such decision, you will help them and help their family to make them happy. Anyhow, Ms. Nadia, I will let you think about this, and we can discuss this later. Tell me about your decision. Do you have any immediate question for me, Ms. Nadia?
Thank you.
Thank you.
Okay, thank you, Dr. Militi. Okay. You did very well. I have only some points. For this station, just to be concise in the first shot. Yeah, you are correct. He was collapsed in critical condition, and his brain imaging show massive bleeding, and I'm sorry, he's going to die. Done. Clear?
Yes.
So what is the problem here? Massive bleeding. He has massive bleeding. Where? In the brain. Okay. So he is going to die. Done. Okay. After that, you can explain to her more. Anyway, you will not finish your station until you mention everything. Don't worry. Okay. Just tell her what is the most important. For example, MI. He brought with critical condition, severe chest pain, blood clot in the heart vessels, and unfortunately, he died. Done. Don't take too long time. Okay. And here also, you show me the CT scan. How I know where is the bleeding? Did you ask? Did you tell me? This one or this one or this one? Clear, Dr. Hussam?
Yeah.
You have to show me. Okay. How I understand this bleeding is large or not? I will compare with the brain tissue. So this is the skull. This is the gray color is the brain tissue. The white color, can you see how much this is the bleeding? Okay. Here also. And this make compression on the brain. And I prefer guys, you start by the scan. Why? Because it will be the start. So this bleeding is doing compression on the brain, and this affect his conscious level and let him to lose controlling of his airway and his breathing. That's why we inserted a tube in his airway and connected him to a machine to help him to breathe. This imaging was seen by the neurosurgeon. So after piece by piece, did you understand? Is that clear for you? Okay. You finished the imaging. Did you understand? Is that clear for you? And this was seen by neurosurgeon. He said it's not surviving, unfortunately. And he is going to die. Stop. Okay. Did you understand? Clear, Dr. Hussam?
Very clear, Dr. Hani, yes.
Yeah. So this how to communicate with the patient. It's not about information or you have to explain carefully and by simple way and clearly. Okay. And steps, logic approach. Always they will give high marks for the logic approach. Logic approach, it means you will start by the imaging. It will give you complication to the airway, complication to the breathing. That's why you connect it to blah, 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 and so on. Okay. Well done. Next one. Yeah.
I want to add something in this case. There is a missing bit in the explanation. It's mentioned in the scenario that the patient was to be should the patient can you show me that the patient should be made comfortable? So that means now the patient is palliative patient. In this case, in the explanation, I will tell the patient that tell the relative that at the moment he's unconscious and because of this massive bleeding in his brain, he's being connected to a machine to breathe for him. If we disconnect the machine, he will die, and because this is inoperable, and that's why we will let you see him, but we will disconnect him from the machine and remove all the tube and remove all the tube going to his throat and tube going to his hands, and we put him in an isolated room and let you be with him. So when we put the patient in palliative, we give medication just to prevent the secretion and the pain. So we have to take the tube out. So we have to mention that now we will take everything out and he will die peacefully. We will make him comfortable in this last hour. And the other thing is when she said that she wants him to be transferred to other hospital because he's unconscious and he's intubated and no ITU will take him, that means we can't transfer him. His condition is very critical. He won't survive the transfer. This is the first point. And the second point that if he is being transferred to other hospital, there is nothing to be done. There is nothing to be added for him. The management will be the same because the bleeding is inoperable and he won't survive this bleeding. So I think if we mention these two bits, it will also consolidate the explanation for the patient.
Yeah. What do you think regarding organ donation?
Organ donation in this patient especially, yes, I will speak about because as I mentioned, I will tell the patient that we will take the tube out and we will disconnect the machine and we'll give him some medication to make him comfortable in these last hours because we expect him to die in the next few hours. I will speak about the organ donation because he's going to die now. But yes, if the patient is going to die, if the other condition than low GCS with massive bleeding that we expect the patient to die in the next day, that means the patient will be with the medical team. So I won't mention that because when it's time for the patient to die, the medical team will explain to them. But here, this patient won't be moved out of the A&E. So the patient will die with us in A&E. So I will speak to the patient about the organ donation in this case. So it's case by case according to when exactly we are expecting the patient to die. 2 hours later, that means he will be in A&E. But if it's 1 day ahead or something, I won't mention it.
Yeah, and here also Dr. Hussam, he mentioned any wishes for organ donation. As we said, we updated this point to Dr. Hussam. Just to mention any registration for organ donation. Registration, if she said yes, register. So register for donate or not to donate. Okay. So
You have to be clear regarding this point, but no need to say any wishes regarding organ donation, because yeah.
The point in the organ donation that everyone by default is registered to donate. The question should be, is he opt out from organ donation? Because by default everyone is organ donor. So the only exception is if the patient opts out. So the question will be, do you know that if he's still organ donor or he opts out from it?
Yeah, but sometimes people don't know about the law. Okay, this is the point. Yes, or people, if they did not register to not donate, should be for donation, eligible for donation, right?
Yeah.
This is the point. Here, some people, they are not aware about organ donation at all. Okay, so you have to ask them, maybe she registered to donate, maybe not. So you have to clarify this point first. Okay.
And about the religious and religious minister, in patient going to die, the relative want to stay with their relative for the longest possible time. So at this moment, they are not thinking about any support, any spiritual support until the patient is actually died. So I think if we opt out on saying this that about the religious, unless the patient is actually died, but if the patient is going to die, you don't actually need to talk about this, because they need to stay with the patient, they need to see the patient and just stay in the room with them until they actually die. Then the support will be offered.
No, Dr. Hani?
Yeah.
For religious belief, I think so need here, because some people, they have religious, like they pray, they will ask some people that they have to pray for the patient. And in every religion, there is like this. If patient is going to die, they will ask that they have to pray for the patient and like this. So I think so.
Yeah, it's just a routine question. It doesn't mean they will come now. Even you said he's going to die maybe, as you said, Dr. Abu Yahya, after 1 hour or after few hours or after 1 day. So the religious minister will come after this, right?
Yes.
So it's a routine question. So you will prepare once the patient will declare this, so the religious minister will attend. Okay.
Just a question, Dr. Hani. And at one point, Dr. Abu Yahya said he spoke about telling the relative of the family, that he will be extubated and left with one of the family member. Should be this the default for the station, or only if it is mentioned in the scenario?
It's not extubated, It's remove the tube.
Yes, the endotracheal tube will be removed, right, and disconnected from the monitor. This is what I
extubated. It means the patient is improving and you will extubate. So you will remove
it should be removed. Yes.
Removed, and we will let the patient die in peace. This is what he means. Some people, they prefer to talk about this point, but it's not a big issue. Even you will not mention about this point, it's not a big issue.
Okay. Okay.
Yeah. Some people prefer that. So it's
mention in additional note, no need to mention it. Just explain to them patient going to die, I'm right?
My point is because it's mentioned in the scenario that he should be made comfortable. That means the decision for the patient to put palliative care is made. Even we ask not to update the ops at all. So the patient will remove everything and will give the patient only subcut anticipatory medication, or it's all subcut medication for the patient to be comfortable. So because it just said that if it's not said that he should be made comfortable, yeah, we can opt out on saying that. But because it's mentioned, that means now we have to initiate the palliative care for the patient and put the patient start the patient anticipatory medication and remove everything.
Yeah, and also you have to emphasize on that
you have to inform the patient, and the consultant advised the patient should be made comfortable. Also, I think me and you, we think about comfortability of the patient. Okay, if she is thinking to transfer to another hospital or. Okay. Okay, thank you, Dr. Abu Yahya. Okay, well done, guys. Okay, so for the next one, the most important, guys, you have to explain well the imaging. Okay.
Dr. Hani, can I just ask one question, please?
Yeah, sure.
In this situation, if you're challenged by the relative, like, for example, in my scenario, the actor, he was saying, well, lots of patients survive these injuries. What would be a good response? Because I couldn't think of it, and I said, look, he's we've seen the images in the ED, the radiologists have reported it, and the consultant neurologist has looked at the images, and they're all of the opinion that this is an unsurvivable, incident. Is there any other approach you would recommend at all?
Yeah, if the patient is insisting to transfer, do you mean that?
Well, to transfer or the seeking other treatment.
Yeah. So regarding the treatment, it's another station, DNA CPR. The patient is complaining why DNA CPR, and it will be another station or different station. Okay. But regarding this station, breaking bad news, and the patient want to transfer to another hospital, once he will explain well regarding the imaging, she will understand. Okay, so here, if you show her the ratio between the bleeding and the ratio between the tissue. So, for example, you explain to her the imaging, and then she said, okay, but I want to transfer to another hospital. She is insisting. Okay, so you have to explain to her that the management is the same here or in another hospital. Okay, this is not survivable and not operable, and also the patient is in critical condition now. I think me and you, we don't want your husband to be uncomfortable. Okay, and there is no further benefits. Okay, and it's critical to transfer the patient in this condition. Okay, so you have to emphasize on the bleeding, emphasize on the condition, emphasize on the same management. Don't say or don't be defending your staff or your hospital. Don't say we are a tertiary hospital, we are the best hospital here. Some people they are telling like that. Okay, no need.
Yeah, Dr. Hani, just one question.
Yeah.
Can in such situation we offer her like some reports if she want to seek another medical advice, or this is not recommended?
I don't like seek another opinion. It will be the
She's
last.
insisting, I mean.
The last
Yes.
option. It's unlikely to insist. Unlikely in the exam to insist at all. They know they. You don't.
In this situation, you already showed the patient the CT. You will mention that this is a massive bleeding, and you know that the bleeding in the brain is abnormal. It shouldn't be there. And if this patient is not the neurosurgery advised not for a surgical evacuation. So unless they take the bleeding out, the condition won't improve. And the neurosurgery are advised against surgery because he won't survive the surgery from the start. That's why his condition is terminal. He won't survive the bleeding because the bleeding is abnormal to be outside the brain tissue. You can explain, but you don't have to offer a second opinion because you're the senior and this is inoperable and this is a terminal, and you know that the patient is dying in few hours. So second opinion, in my opinion, is not. It shouldn't offer. You can convince the patient. in by you.
But if you want a second opinion, Dr. Ahmed, it will be like what I will phrase
I mean,
again.
second opinion in another hospital, for
Yeah,
example.
yeah,
if you
yeah.
said,
I
I
understand
know
your
a
point.
doctor
I
there is very
understand
good.
your point.
That is my point.
Yeah, yeah. I understand your point, and I will answer you. So you are the most senior, and you will refer her for second opinion another hospital for the same specialty and for the same level as you. Okay, no worries. So you can take this imaging and seek another opinion in another hospital if this make sense for you. Did that clear for you, Dr. Ahmed?
Yes, Dr. Hani, this is what I was asking. Thank you.
Yeah. So here, no worries. It's a right for any patient or any relative to take the imaging, but not take the patient. Okay, take the imaging, and you can ask in another hospital for second opinion. No worries. Okay. For example, you are the consultant neurosurgeon, and you said this not survival. She can take the imaging, and she can ask anyone. No worries. Anyway, guys, it's not for the purpose of the exam. It's unlikely to happen like that. Okay. Can we proceed?
Yes, sir.
Yeah. Okay. So next one, Dr. Ramesh.
Yes, Dr. Ani.
Yeah.
Okay, 45.
You can start.
Yeah. I will knock the door, wash my hands, wear the PP, turn off my mobile, turn off my beep, and hand over my department to the my colleague and make sure that everything is safe in the ED. Okay. I will ask for any notes or any additional documents regarding this patient. Okay. Okay. I will read the documents. Okay. Try to point out the main things in that one. Okay. 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 Finish. Okay. Good morning. My name is Dr. Kumar, ED physician, and may I know your name in relation with the patient?
Yeah, I'm Trisha. I'm his wife.
Okay. Mr. Shea, is there even anyone with you to attend?
No.
Yeah, we will sit in private room and my nurse will be with us. Is that okay with you?
Okay.
Mr. Shea, do you want to take any drink or anything?
Please tell me what happened.
Yes, I'm sorry that you are here today. So, what do you know so far regarding the condition of your husband?
Yeah, he has liver cirrhosis before, and has history of alcohol drinking for 10 years. That's why he had liver cirrhosis. Today he is vomiting blood, and I called the ambulance. They brought him here. What happened to him?
Yes, that is correct. And today he has been brought in emergency department in a very severe critical condition, along with the means like bleeding in the vomiters. And unfortunately, I'm very sorry to say that I have bad news for you, that your husband Jihad is going to die.
Going to die?
Okay. When she stops weeping, I will offer the tissue and water. Okay. So, Miss Tracy, do you want to tell me more regarding that one? Miss Tracy, did you understand what we discussed before.
Okay.
Okay. Do you want to know more regarding that one?
Yeah, please.
Sure. Well, he was brought today, as you told that he was brought today in emergency department, and there was a huge bleeding in his vomitus. Okay, and our team members have tried our best, and we tried to give him oxygen through the tubes and put machines on him to give him oxygen to help him to give him breathe. But unfortunately, as you know, he has a liver. He was alcoholic, so his liver was not functioning more, and we run some blood test, and which shows that blood is not his liver is no more working, and for that we consult with the hepatologist, the specialist for the liver, and but according to them, unfortunately, the bleed is too much, and he will not survive. So unfortunately, he will die. Miss Tracy, did you understand?
Yeah.
Okay. Do you want to call anybody from your friends or family members?
Yeah, I want to call my brother.
Okay, I will arrange that. I will arrange to call to them. Okay. Do you any children or any other vulnerable person at the home? So do you want to bring them here?
Yeah.
Okay, I will also arrange for that. Okay, so is your husband or you are a religious person? You want a religious minister here to be present in the last moments?
No.
Okay, so is your husband has a register for the organ donation?
No.
Okay. So do you want to see and touch your husband?
Yeah, please.
Yeah, okay. So please give us some time, so we will prepare for the things that you can touch and you can see him. Okay. Mr. Said, do you have any question for me?
Yeah, I want to transfer him to another hospital. My uncle is working as a manager in tertiary hospital.
Mistress, yeah, I can understand your situation, and I do understand that is very difficult time of your life. But I want to reassure you, the outcome of this patient will be same even if you transfer to any hospital, because it has already been reviewed from the hepatologist, and the result will be same in every
Thank you, Dr. Ramesh.
Thank you.
Well done. Yeah. Here, just concise your answer. The management will be the same in
yeah.
hospital. Done.
Yeah.
Okay.
Yes.
Don't make it difficult for yourself.
Okay.
You did very well. Here, regarding liver cirrhosis, and so you have 3 stages. Okay, class A, class B, class C. So anyway, it's not about knowledge. They are not testing your knowledge. Maybe they will give you a report. In the report, they will mention it's a class C. Okay. For that, you will understand the patient has a grade 3 or 4 for encephalopathy, moderate to severe for ascites. Also, blood profile is abnormal. Okay, that's why the patient has massive bleeding and also liver failure. Okay, maybe They will give you information about enzymes or function. Okay. So anyway, try to use any information inside the notes. It will help you to give a clear idea to the patient or to the relative. Now we are just verbalizing information from our minds, but in the scenario, you have to mention exactly what is mentioned in the notes. Well done, Dr. Ramos.
Dr. Hani, just a question. Here, in the task, it wasn't mentioned that he is about to die or that the consultant opinion is to make him comfortable. So should we assume that he is going to die, or it could be a breaking bad news that the patient just in a coma right now and his condition is critical?
Yeah, that's why I told you here regarding the notes, it will be clear. The patient is not survivable, and the consultant said should make comfortable, and he's going to die, maybe mentioned also in the notes. So you have to depend on the notes.
Okay, doctor.
Okay.
Okay, thank you.
Hello.
Yeah.
Sir, regarding organ donation in cirrhosis, can we talk about that?
Cirrhosis, it's not for organ donation.
Okay.
Or you mean organ donation for other organs?
Ah, yeah. Yes, sir.
It depends. Maybe the patient has
Because he's serious and he has a hepatic encephalopathy, and that's why I'm asking.
yeah, here it depends. Maybe the patient has organ failure. Maybe kidney functions not normal. Okay, so it depends on the notes.
Okay. Okay.
Yeah. Okay, next one. Dr. Amjad.
Yes, hello, Dr. Hani.
How are you?
I'm good, thank you.
Yeah, you have 30 seconds. You can start.
Okay. I'm gonna ensure the department is safe, and I'll switch off my mobile and my brief. Good morning. I'll check the notes. Good morning. I'm Dr. Amjad, ED registrar. May I know your name and your relationship to the patient, please?
Yeah, I am Nadia. I am his wife. What happened, doctor? Please tell me.
Okay, I will tell you in a minute, Miss Nadia. Well, I'm gonna take you to a private room. And what do you know so far about the health of Mr. Fuji?
Yeah, he was collapsed at home, and he has history of chest carcinoma. Okay, but I don't know what happened, doctor. Tell me, please.
Okay. Mr. Fuji was brought to us in a critical situation. He was unconscious and he was not able to breathe. We did all the efforts and all the necessary resuscitation, and we have very bad news for you that he has a chest mass and he has swelling, he has brain problem, and I'm sorry to tell you that, but he's going to die.
Going to die.
I understand this is a very difficult situation for you, but our consultant neurosurgeon, he did a CT scan, brain imaging for Mr. Fuji, and he found that there is some swelling in his brain, and he has also done imaging for his chest, and there is a mass in his chest, and he is going to die. Can I offer you some water and some tissues?
Thank you.
Okay. I know it's very, very difficult for you, but do you know if he is registered for organ donation?
He registered not to donate.
Mm-hmm. And would you like to see Mr. Fuji?
Yeah, please.
Okay. Just give me some time to arrange for you to see him and touch him and speak to him. And do you have any, do you or Mr. Fuji have any religious beliefs?
No.
Okay. Do you want me to show you his brain and chest image?
No, I don't want.
Right. I'm so sorry for what's happened, but you know, he has this critical situation, and he had most probably tumor in his chest that affected also his brain. Do you want us to call anyone?
Yeah, I want to call my brother.
Okay, I will arrange for that. And do you have any children at home?
Yeah.
Okay, we will contact the social support and we'll arrange for them to be in safe hands. I am so sorry for his situation.
Okay.
Okay. And we will support you and support Ms. Fuji, and we ensure that he will have the best medical care. Do you have any questions for me? Would you like to ask about anything?
Yeah, I want to transfer him to another hospital, doctor. My uncle is manager in tertiary hospital.
Yeah, I appreciate that, madam. But his clinical situation makes it very difficult for the transfer. And the other thing is that the care he receives here is the same he will receive everywhere. It's not doesn't depend on he will have excellent care here, but his situation is really critical, and it's very difficult to transfer him. Do you understand me?
Okay.
Yeah. We will be here. We will arrange now for you to see him. We'll just clean the area and make it less scary for you.
Thank you, Dr. Amjan. Well done. Okay, well done. Here also, if you find X-ray, you can show here. If you find brain imaging, you can show here. Well done. If you don't find, no need. Also, regarding the concise warning shot, the first one, Dr. Amjad, try to concise. What is the problem here?
Metastasis and
Metastasis. So the problem here, brain or chest? Dr. Amjad.
The brain.
Brain, excellent. So you can focus on the brain. She said he has history of carcinoma, lung carcinoma. So correct, yeah. I'm sorry, I have bad news for you. He has brain swelling because of fluid inside his brain, and I'm sorry to tell you he's going to die. Done. Okay?
Okay.
So focus on the problem first. In the scenario for Dr. Ahmed Al-Amin, it will be clear here the patient is not survivable or not operable, and the consultant said he should be made comfortable, and so it will be clear in the notes. Okay? Yeah. So after that, you can offer tissue, you can offer water, and to keep good eye contact. After that, you can explain more. Clear, Dr. Amjad?
Yeah, clear, Dr.
Yeah, don't be in a hurry to explain everything in the start. Okay?
Okay.
Yeah. You did very well, but just this only 1 point.
Thank you.
Welcome. Next one, Dr. I want to someone new. Anyone want to practice? I think Dr. Raj, you practiced before.
No, yes, sir. I practiced that history taking miscarriage. So I want to try breaking bad news again. Can
Okay.
I?
Yeah.
No, this.
Yeah, this one you can practice.
Okay, thank you.
Okay. So the patient here, it's not DNA CPR. This station, the same station, can come as DNA CPR and they can come as breaking bad news. Don't be confused. Okay. If they mention the daughter is complaining, so it's a DNA CPR. If they mention the patient has no same scenario, but no complaint, so it's only breaking bad news. Okay.
Okay, sir.
Yeah. So you can start.
Okay, sir. I need to wash my hand. Here are my personal protective equipments. I'll make sure my department is safe and I hand over to my senior colleague and I'll switch off my bleep and I'll review the notes if available. Hello, I'm Dr. Rajalakshmi, ED Registrar. Can I confirm your name and relationship with Mrs. China, please?
Yeah, I am her daughter. I'm Olivia.
Nice to meet you, Miss Olivia. Would you mind if we sit in a private room and I'll ask one of the nurse to attend with us?
Okay.
Do you need anyone to stay with you?
No need. Please tell me what happened, doctor.
Okay, I'll explain everything to you. Before that, do you need anything to drink?
Okay.
Okay, I'll offer you some drink. Can we have a seat, please?
Okay.
Okay. Tell me, Mrs. Olivia, what do you know so far about Mrs. China condition?
I know she was collapsed and the ambulance brought her here, but I don't know what happened.
Yes, that's correct. Your mother, Mrs. China, brought to the emergency after he had a collapse. And when she came here, her blood pressure was low and her heart was stopped beating. And we tried to resuscitate her and we bring her heartbeat back. But unfortunately, he depending upon her medication now. I'm sorry to tell you, she's going to die.
Going to die.
Sorry, it's really hard for you. I'll offer you some tissues. Do you understand what I said?
Yeah.
Yeah, would you like me to explain more?
Okay.
Your mother brought to the emergency with a low heartbeat, low blood pressure, and low GC, low consciousness. And we tried to resuscitate her with we inserting some tubes to help her breathing and connected to the ventilator. And unfortunately, and we tried to resuscitate her and bring her heartbeat back, but now she depending upon the medications and ventilation, and her heart is very weak, and she has been reviewed by a cardiologist team, and who has said her heart was weak, and she is depending upon the medication. So unfortunately, she's going to die. I'm sorry. Do you need anyone to call?
Yeah, I want to call my brother.
Okay, I'll arrange for that. I'll call him. Do you have any children at home? So I can bring them back to hospital.
Yeah.
Okay, I'll talk to the social service regarding that. Do you want to see your mother? And
Yeah, please.
okay, I'll arrange for that. There is some wire and some injection around her, and I'll make the surroundings pleasantable. So once we have done with that, I'll take to you to see her. And I want to ask you something, and ask you one question. And it's not an appropriate time, but we usually ask everyone. Does she register in organ donation?
Yeah.
Okay. Can we proceed with that?
Okay.
If you are happy to. Okay, thank you. And I'll call Bravement office regarding further advice and paperwork. Would that be okay with you?
Okay.
Do you have any immediate question for me?
No, thank you.
Thank you. I'll let you to see your mother.
Okay. Thank you, Dr. Raji.
Thank you, sir.
Well done.
Thank you.
Well done. Okay, but I want you to work on the first shot. Okay. So what is the problem here?
After arrest, she came to the, and she attained ROSC. Yeah.
Okay, she has ROSC. So
Yeah.
what is the problem?
Now she's depending on the medication.
Yes, what is the problem?
Heart.
I mean, deteriorating, not responding to medicine.
Yeah, it's not responding, deteriorating.
So you have to mention that.
Okay. Okay.
You can say, yeah, she is in critical condition. She brought, her heart was not beating, but now is beating, but not responding to treatment and deteriorating. And I'm sorry to tell you, she is going to die. Done. Okay. Concise as much as you can.
Okay.
After that, she will cry, or maybe in the station sometimes she is not crying, but at least be silent for 5 seconds.
Okay, sir.
If the patient is looking down and not crying, and sometimes she's looking at you, not looking down, and sometimes she's not crying. So stop, don't continue. Look at her, no problem. Look at her for 5 seconds. Don't continue. Okay. After that, would you like me to explain more? Okay. After that, you can say her heart not beating, and then we moved her resuscitation room. called all specialties related to such a case, and we try to resuscitate her. Her heart start to beat again, but unfortunately, her conscious level is very low. Her blood pressure is very low. We tried to give her medicine to support her heart, to strengthen her heart, but unfortunately, not responding, and she is deteriorating. And we are expecting her heart will stop again.
Okay.
Clear now?
Yes, sir. Clear.
Yeah. Very easy. First shot, second shot. After that, children at home. After that, do you want to call anyone? After that, you can talk about religious beliefs, can talk about registration. Again, guys, here you have to ask about registration because some people, they have no idea at all about organ donation. Did you get my point?
Okay.
We know, yeah, all people should be registered by law until proven otherwise, right?
Okay.
But they don't know. Some people in UK, they don't know about organ donation at all. Okay. Some people, they don't know about changes of law. Okay. Okay. Some people, they know about registration. So they went to the website in NHS and they register to donate. And some people, they register to not donate. And some people, they don't know about anything else. So you will take organ donation without consent? No. You have to inform them first. You have to discuss with them. Okay. Anyway, it's not a big issue. The most important, your approach, your logic approach, and your tone, your attitude, your body language, your good eye contact. Clear, guys?
Yes, sir.
Yeah. Okay. The last station, who will be happy to do that? C4 fracture. Anyone is happy to do that?
I can do it, Dr. Rahman.
Okay, Dr. Ahmed. Okay, you can start.
Okay, I'm going to wash my hand, put on my PPE. I'm going to make sure the department is safe, handed to a senior colleague. My phone and bleep is off, a nurse with me to support the family, and a private room available. And I'm going to review any additional notes regarding the patient. Okay, I'm going to approach the wife. Hello, ma'am. I'm Dr. Ahmed Al-Amin, ED registrar. I am the senior here. I believe there is something you wish to discuss regarding your husband, Mr. Jack. Is this correct?
Yeah.
Yes, I'm here to discuss his condition with you, ma'am. But do you mind if we move to a private room and one of the nurses will be attending with us?
Okay.
Okay, did anyone attend with you?
No. What happened, doctor? Is he okay now?
I'm going to explain everything for you, ma'am. So can you please have a seat?
Okay.
Can I offer you a drink or anything else?
Okay.
Can you please tell me how far you know regarding your husband's condition and what happened?
Yeah, they called me, they said he has a road traffic accident and they brought him here by ambulance. So what happened, doctor, please?
Yes, ma'am, this is correct. Actually, your husband was brought here. After examining him and imaging, we find he's having a fracture in the fourth spine in his neck. And I'm so sorry to tell you that he will not be able to move his arms or his legs permanently.
Oh.
Let me offer you tissues and a cup of water. Mrs. Nadine, would you like me to explain a bit more about what happened?
Yeah, please.
Yes, actually, Mr. Jack, your husband, he was brought by the ambulance after a major road traffic accident. He was received by our resuscitation team, and he was resuscitated, giving medications, and investigations were ordered for him. This involved also scanning of his neck. After that, the images was reviewed by the neurosurgery consultant, who said that the fracture that he has in his neck will make him unable to move his arms or his leg permanently. And there is no cure for this condition. I am so sorry for what happened to him. Is this clear for you, Mrs. Nadine?
Okay, so the fracture, where exactly, doctor?
It is in the fourth cervical vertebra, the fourth vertebra in his neck. This is the area of the upper part.
So
yes,
he will not move his limbs forever, or it will be depending on the management physiotherapy and
no, actually, I'm so sorry to tell you that it is permanent. You will not be able to move them. But let me explain to you a bit more about what is going to happen. Is this okay for you?
Okay.
Okay. Actually, he will not be able to move, as I told you, his arms or his legs. He will also might have problems in his speech and his swallowing. He will need a complete support for his daily activities, like his bathroom, eating, and drinking. Is this clear for you, ma'am?
Okay.
In the future, he might be able to use some special, oh, so sorry. In the future, he might be able to use some special, like wheelchairs, automated, which help him to move from one place to another, but still he will need your support. Is this clear for you?
Okay.
I'm going to supply you and give you some leaflets that will help to explain everything more for you and what is expected in the future. At the time being, do you have any immediate questions for me?
Yeah, I am not able to do that, doctor. I cannot support him.
Oh, I see. I'm so sorry for that. I will contact the social services. They will provide you with a nurse that will help you and teach you in the beginning on how to deal with your husband and how to support him. Would that be okay with you?
Also, I have another question regarding sexual function.
Yes, I'm so sorry to tell you that the sexual function will not be the normal like before. However, there are specific devices that can be used and can help to improve the sexual action, but it will still not be the normal, like some constriction rings that can be used. But the good news that still you can get pregnant if you wish through assisted reproductive technique. Do you understand this?
Yeah.
Mrs. Nadine, do you wish to call anyone to attend with you?
Yeah.
Okay, let me ask one of my colleagues to arrange for that. Okay, do you have any children at home that needs to be
Thank you,
looked
Dr.
after?
Ahmed.
Thank you, Dr.
you. Okay. Well done. Amazing. I only have two comments. Okay. Number one, your time management. Sometimes we are decreasing our tone, we are lowering our speech, and we are wasting our time. So you have to make balance. Okay?
Okay, doctor.
Yeah. Don't be fast, don't be slow. Also, take care about your time. Here, regarding the concern, you can keep the concern to the end, right? The questions to the end. So
yes.
You have to give the first shot. After that, tissue and water. Second shot. After that, do you want to call anyone? Okay. Any children at home?
Do you want to see him and touch him? I like if you say see and touch. Don't say see, don't say touch. I like see and touch. Clear, guys? And also, after you finish, what is your concern? What do you think? Okay, and you can answer all questions. So if you finish everything, Dr. Ahmed, in the start, at least you get 6 or 7 marks, right?
Yes, Dr. Hani. Here I was confused whether to explain to her more about the C spine fracture first or to
later in the end.
At the end, okay.
Yeah, and here I have one point also. I wish if you start by, I have bad news for you. He has fracture vertebral body number 4 and complicated by paralysis for all limbs. Done. I have already, she said he has a road traffic accident. So no need to mention road traffic accident. Yeah, correct. And unfortunate, I have bad news for you. I'm sorry to tell you, I have bad news for you. He has fracture of vertebral body number 4 in his neck and complicated by paralysis in all 4 limbs. Okay, done. Here, is it permanent or it depends on physiotherapy?
Permanent.
Sure?
No, there could be some improvement with physiotherapy, but still it will not be the usual.
Okay, so what do you think, guys?
I guess it is
I
recoverable
think
with time and
physiotherapy can little help,
physiotherapy.
yeah.
Okay, so here the prognosis may be bad, but it's not permanent, right? Permanent, it means it's the prognosis 0 point. So here we don't know what will happen tomorrow. Okay, so just mention paralysis 4 limbs. Clear, Dr. Ahmed?
Yes, Dr. Hani. But if she asks if it is permanent, I should say we still don't know.
I'm sorry to tell you, it's a bad prognosis, but we have to support him and we need to involve a physician or physiotherapy, okay? And this will help him to recover. Here, serious diagnosis, it doesn't mean it's permanent, okay? Serious diagnosis may be it's 1 year, maybe 2 years, maybe 10 years, okay? We don't know what will happen tomorrow, okay? And so on. Anyway, you did very well, amazing. Your point, time management, and keep the eyes to the end before management plan. And the management plan involve feeding, breathing, also social support, 1 nurse for her. You will provide her with printed leaflets, videos, website to guide her more. Okay, so here teaching also, you have to provide teaching and answer any question. So if she asks about sexual function, you can provide here. If she asks about support, you can provide here as you did. Anyway, you did very well. Just organization of the approach. Clear?
Yes, Dr. Hani, clear.
Yeah. So here from C1 to C4, you have to be familiar with that. If they give you in the exam C5 to C8, so you have to be familiar with that. Okay. So here, most severe of a spinal cord injury, you have to tell here, this is the most severe, and the paralysis in arms, hands, trunk, legs. Patient may not be able to breathe on his own cough or control bowel or bladder. You have to provide this information. Ability to speak is sometimes impaired. Just mention step by step, mention that like that. When all 4 limbs are affected, so it's called quadriplegia. Require complete assistance with activities of daily living, such as eating, dressing. You can inform here one by one, okay? May be able to use powered wheelchair, so we have to provide you with wheelchair with a special control to move around on their own. Will not be able to drive a car. Require 24-hour a day personal care. You be familiar with this point. You can mention them one by one. Okay. Okay, so this is the first support and action. It will be in the end after you ask. So here you can organize this approach also. If I will update this slide, I will mention family or friend first, after that children at home, and I will keep eyes to the end. Okay, well done, Dr. Ahmed. Amazing. Okay.
Thank you.
Any question, guys, before we start?
Sir, can we get a PDF?
Yeah, inshallah. Anyway, guys, I am busy this time. I will be free after 15 March, very free, inshallah. So I will try to do my best to finish everything also. But at least I am doing my best in this time, inshallah. Okay. Thank you, guys, and bye.
Thank you so much.
Yeah,
Thank you so much.
hello, Dr. Ani.
Yeah.
Yeah, please, can we have like schedule for the next few days so we can know how to plan our time also?
Yeah, I put already. I put the schedule.
There is.
I put in the group.
Okay, so it's gonna be daily. It's every day.
Yeah, we are doing it daily, and from March, once we finish, we will do active practice, inshallah.
Okay.
It will
Thank
be
you.
practice only for 18 stations, not exams.
Oh, okay. Thank you.
Welcome. Bye-bye.